everyone to the third edition of PHA Summit.
Good morning. Good morning, everybody. Please take a seat. The show will start in 1 minute.
Well, good morning. Good morning, everyone, and please be very welcome to the third edition of the VHH Summit. My name is Helena Canadell, and it's a pleasure to me being here and enjoying with you this third edition of VHH Summit. Well, digital health, it's not the future. Actually, it's a reality right now. So I'm very much looking forward to learning what's this new reality and what can offer in terms of digital health. This year, we are streaming from this magnificent San Pau Auditorium in Barcelona, where the VHA Summit was held last season, but this year on a real hybrid event, because all of you that are joining us from home, but plenty of you staying here in a physical event, finally. Wow, it's very nice to see you here in front of me with the possibility to touch us. Well, not to touch us because we need to follow the COVID regulations, but at the end, we are here all together and we have to celebrate it. Before we start, and as I said before, we need to follow some important rules in terms of the COVID rules. So, first of all, when you are here inside, please use your FFP2 inside all the recinto, right? The second one, if you need Wi-Fi access anytime, you can use it. You will find user and password on your badge. So just take all the information and you can use it for all the day, right? The third one is please just silence your mobile during the event. This is just to me, to don't have any distractions. And, well, smoking is forbidden here inside the recinto. So when you need to smoke, please go outside, not in this inside garden. You have to go inside in the first entrance. But to be honest, you shouldn't smoke. Smoking is not too much healthy, and we are on a digital health event. So, well, this is just a recommendation. Well, important for you to have the best experience as possible is downloading the app. You can use the QR code that appear in your screens or here behind me. Use it, download the app, and use it for networking. You can use for all the attendees, not only the ones you are here, but also people who is enjoying the meeting from home, okay? Well, let me open this third edition of Summit with the message of thanks. Thank you, first of all, to all of our sponsors, without whom this event would not be possible. Sham, Novartis, AstraZeneca, B. Braun, Roche, Multiplica, Alexion, Lookup, Suboca, Iomed, Thrive, Viva. Well, to all of you, all the rest of companies that will be participating today, thank you very much to make it possible. I want to also thank you to Barcelona Health Hub partners who are continuously supporting by spreading the word about all the activities and making us the international hub that we are. Thank you. And thank you to all of you for being here today, either physically or at home, wherever you are in the world. Thank you very much. Let's now have a look at what is waiting today for us. We have a great agenda ahead, and with a very exciting topic, the patient journey of the future. It is a topic that resonates with all of us. All of us, we have patients around us, and for sure, we will be patients at some point. So the role of that patient has evolved those past years, putting it more and more at the center of the care and being more involved in his own health and the decisions related to do it. And technology, well, technology has really been a big driver of that change. Today, and regarding this patient journey of the future, we will have focus on 3 points, 3 main topics. First of all, the liquid hospital, or how the care is moving away from the hospital settings. Second one is putting the patient on the driver's car, on the driver's seat. And the third point is data and data economy, or how to ensure we can collect quality data and what can we make of them. During the day, we will have panel discussions, startup demos, and breakup sessions organized by our sponsors and partners. So don't forget to check all the agenda through the app. Remember, you can use the QR code if you want to download it, if you didn't do it before. Then, during coffee break, remember that we will have, and lunch, of course, you will be able to visit the physical booth downstairs, but also the online booth. So, again, using the app or the website, of course. The show and tell startup presentations will be happening here live on stage during the whole day. But in the conference app, regarding the section video, you will have extra videos from all the companies available on demand during the day. So on demand, the same that Netflix, but with digital health content. So don't forget to use it. And remember, networking. Networking is available, as I explained before, by using the app, for using the QR code, first of all, and then you can be in touch with exhibitors, with attendees. You can fix a meeting with anybody of you, so please use it, and for sure will be easier, much more easier for you to meet yourself. And of course, my favorite part, don't forget to tweet about the meeting. Here you have the hashtag that we will be using during the event, is hashtag VHH Summit. And to inaugurate, What do you think if we can start with a selfie with all of us? So if you don't mind, take your mobile phones. I will do the same. Let's take a picture and use this hashtag. So just give me a second. And just a smile, because this is for all of us. You can do the same. You can take your own phones, take your photo. Okay, 1, 2, 3. That's nice. Okay, thank you. Now, you just have to upload it using BHH Summit hashtag. Well, let's start with the program. And we will start with the state of digital health with Luis Bardina and Christian Pascual. It has been a very special year for digital health, and a lot has happened, and we had to work hard and improve very, very quickly. In these terms, Christian Pascual, our president, will give us an overview, while Luis Pardinas will tell us how Barcelona Health Hub fits in this new era. So, Christian, whenever you want, welcome on board, and the floor is yours.
Well, first of all, I'm really glad to see you again, to see you physically. And we had already interact with some of you, and it really feels good. Well, we are here to celebrate that digital health era has started, the golden age of digital health, and I think that we have an amazing agenda ahead. But let me just try to give you some thoughts and pictures about what we have today in healthcare, and specifically in digital health. I think that what we have right now in healthcare, it's the perfect storm coming. Because, there's a rising demand of healthcare. We have aging population, growing population, with an increase of chronic patients, and we have been seeing the expense in healthcare growing over the GDP in most of the countries of the world. Of course, COVID has not helped. COVID is accelerating all this that was already happening. And on the other hand, we all know that we have a lack of physicians and nurses. There's not enough professionals in the world to give to everyone what the healthcare that we want. So this is the problem that we are facing. It's a big one. But I have good news. I think that digital health is really solving many healthcare challenges. And many of you will showcase incredible ways to figure out how to beat these challenges that we all need to beat. We need a more sustainable, a scalable, and inclusive healthcare. And I think that, and I have said many times, I think that artificial intelligence and telemedicine alone will provide a huge disruption in the industry that will allow us to have a better healthcare and to beat these challenges. And I think this is already happening. As Elena said, this is not that we are seeing that it's coming. We may have seen that this was coming on 2011, where when Startup Health started to monitor the amount of money that was invested in digital health in a global scale. So you see the numbers, and I think they speak by themselves. We have seen a huge growth of the investment in digital health, and this year it's a record year. Of course, we have all felt it. COVID has accelerated the adoption of digital health. We have seen telemedicine raising and a huge adoption worldwide. McKinsey said that has been multiplied by 40 in the US, the adoption on telemedicine. And we see this in the investment from the investors putting in the ecosystem. On the other side, I think that it's also very interesting another study from McKinsey that was showing what are the thoughts in the mind of the executive in healthcare. And well, I took my outcomes of that. They already identified digital health as a key factor they have to face in their organizations. On the other side, startups, we need to provide clear outcomes. What are the benefits that we provide to them? This is, I think, important. Not only a solution that is technically nice, so how to set it up in the market is really important. And patients are looking for integrated journeys, not alone solutions. And I think that we have seen that already happening. A lot of players have really been grouping a lot of startups, providing different tools to provide an end-to-end journey to the patient. Telemedicine leading to online pharmacy, that's an ideal patient journey for a patient. I want that. Symptom checkers leading to telemedicine. I was glad that this was mentioned. Of course, I'm in the game in this. So I think that a clear digitalization strategy, it's not happening in all these corporations. We see some movements, everyone is interested, some of them are really working with a clear strategy, others are not, just doing some things, maybe not fully integrated with their strategy. And big tech players will play a role, and we have seen that. Google's, Facebook's, Amazon, everybody has moved in healthcare, and this will come. And we'll talk more of them in the next years to come. And finally, a good outcome. Corporations prefer to build the front end and leave the back end to integrate all the technology that we are building. So I think this is important outcome for all of us. While this is happening in the world, I think that in Catalonia, and we have seen that since the beginning that we started Barcelona Health Hub, we have a vibrating ecosystem. It's huge. This is one of the latest maps of the ecosystem in Catalonia, but you know it, you feel it. I mean, just the hub itself has grown incredibly since the beginning. And now the money is starting to flow in a different level. And we have seen recently 3 good rounds, Coa Health, Top Doctors, and Medictor, all over 10 million rounds. This is new. I mean, this was not happening some years ago. So we are seeing some consolidation in the investment that will allow to grow these solutions, scale, and then ease the way to others. So this is a big opportunity. And we have believed in that since the beginning that we create Barcelona Health Hub. Barcelona is a unique place to innovate in digital health. We have everything. We even have this location which cannot be copied to anyone, anywhere, that I'm sure you will enjoy today through the event. And when this is what I wanted to tell you, I really think that digital health is happening, that we are starting the golden age of digital health, and I really hope that you enjoy the journey. And talking about what's next, we already have built a plan. It's an ambitious plan to grow the hub beyond what it's today. We have imagined how everything that could be done, and Luis will talk to you more about it. But before, we'll leave you with the video that we launched to introduce our strategy. Thank you. Barcelona Health Hub is a non-profit association with the mission of promoting digital health innovation and its transfer to the medical practice. We are already the largest digital health hub in Europe, but we have the potential to continue to grow and consolidate our position as a top-list global hub. For this reason, we present the key points of our strategy.
The Hospital de Sant Pau aims to provide an environment to validate the solutions and technologies that will shape the hospital of the future.
We believe it is essential to create a benchmark training center in digital health technologies and knowledge.
We want to create synergies and collaborations between the different actors of the healthcare ecosystem.
We consider it important to establish an incubator to help create and promote innovation initiatives that will lead to solutions for our health system and have international projection.
One of our main pillars is to attract venture capitalists, both national and international, to all the digital health projects that are being developed in the Hub ecosystem.
It's a great opportunity to convert new spaces within the Art Nouveau site, to expand those dedicated to innovation in digital health.
We will consolidate our position as a relevant communication channel and opinion leader in digital health.
We create and provide the technology needed to transform the digital health sector.
It will be wonderful to create a health innovation center dedicated to technological transfer to clinical practice.
We promote innovation in the medical community. That is why we support the Barcelona Health Hub in this mission.
We will increase the hub's connection with other Spanish regions, with other countries and continents.
Now more than ever, healthcare systems face major challenges. Our mission is to impulse all these innovations in order to bring them to the patient. This results in a more scalable, inclusive, and personalized healthcare. Contact us and let's start collaborating. Thank you very much.
So hello everyone, it's a great pleasure for me to be here, and I want to give you a warm welcome to BHH Summit 2021. We've seen from Christian the great evolution has been made by digital health, and especially in investment, and also we have watched the video talking about the future of Barcelona Health Hub, taking in consideration the big advance that we are going to make after this planification we have done to convert Barcelona Health Hub as the largest hub in Europe. But first, I want to point out that in February 2001, we were recognized, Barcelona Health Hub was recognized as the very young. We have this recognition is very important for us. Barcelona Health Hub, the mission is to impulse innovation in digital health and its transfer to the medical practice, connecting all the ecosystem, connecting startups with corporations, with health institutions, with investors. So this is very relevant for all of us. So in just these 3 years, we have built a very important community of more than 300 members around the world. So this is really, we are very proud on that. So first, I'd like to say that we are going to be one of the largest, as Christian has already mentioned, the largest digital health in Europe, taking the advantages as well of the European funds. So our goals are, and our key pillars of this strategy space is these 4 pillars you see on the slide, which is first, technological transference, which means develop a digital health technology transfer center connecting hospitals with the ecosystem. We are helping the startups to get into the hospital to reach as soon as possible this clinical validation. This is really very important for the ecosystem and also for the innovation to get into the hospital and get to the patients. The second is digital health knowledge, to become a reference center of the generation, dissemination, and exchange of knowledge in digital technologies applied to health. So being the center of the knowledge around the world, and especially in Europe, but producing reports and creating a specialization for the health industry and the health ecosystem. Now, the third one, we want to create a startup incubator, a big one, a startup incubator, expand the incubator to promote a startup in this ecosystem, rehabilitation, and unique space in the Recinto San Pau, where really we are right now. And finally, a global expansion, which means connecting and expanding the hub's presence to other geographies to help broaden the ecosystem. This is one of the important conditions for the European funds, so we want to spread our knowledge and our ecosystem around the world, around Europe. We have to take into consideration that our community comes from 5 continents, so we are in the way of doing that. So having said that, thank you very much for your time. I pass the floor again to Elena. Thanks a lot.
Thank you. Thank you. Wow. What a great way to kick off the VHH this edition, right? For sure we will enjoy the day. But now it's time to carry on with the first panel, in which we will talk about the hospital of the future. Remember that you can use the app or the website and can ask your questions in the chat next to the streaming video. In the platform or the app, of course. So Christian will be able to pick them up and answer it during the panel. So, Christian, time for you. I will leave you the floor again for the panel. So,
thank you.
Here you
need
have.
to put some more chairs.
Of course. Like this. Okay.
One more.
One more.
Please.
Yes, for all the first panelists, whenever you want, take a seat. And let's start with this first panel talking about this hospital of the future.
Yeah, you can take all the
Brutal.
Well, hello again. I think that we have great panelists to discuss about the Liquid Hospital today. So, better than me introducing all of you, I think it's better that you do it yourself. I'm sure you do it better, so please, Patricia, do you want to start?
Thank you, Christian. It's okay? Yeah. Thank you. Well, I'm Patricia Ripoll. I'm patient advocate in migraine. I start in migraine, but later I start to work with patients in all of disease, because I see that the work that we have to do, the patients in all of the disease, it's the same. Then I start to work with hospital institutions and also organizations to work with the point of view of the patients. And then this is more or less. I was a commercial director in pharma sector, and then I have to stop to work due to my migraine. And then this is the moment then I start to try to change the way of work in the organizations, and then after in the hospitals and all of the institutions, because I think the patient has to be not the center, it has to be one of the key and another part of the center and another part of the stakeholders.
Thank you. Tessa, please.
Okay, thank you. It's for me a pleasure to be here in the Barcelona Health Hub. I love to be in Barcelona, and for us, as I said, it's a pleasure to be here. In my experience, I've been running hospitals for the last 12 years, both in the public and in the private sector. And now I'm fully involved in this new project that is called SHAM, an insurance company that we are specialized in the insurance of the health professionals. And as you say, the patient. Okay, for me and for us in our company, Imagine, we are always, and we had the point of view absolutely fixed in the patient. Not only in the patient, and both in the combination patient and professionals, because they can be, you know, at any moment be apart. So I think this is a great moment to talk, you know, because after the pandemic, the things are changing, or are supposed to be changed, and we have to start this new normality, you know, with the learning of this past period. So, you know, thank you for the opportunity to share with you this time.
Sure, thank you, Cesar. Arnau, please.
Thank you. Very happy to be here today with such a panel. I'm Arnau Valls. I'm engineer as a background and working for some years in Sant Joan Déu Barcelona Children's Hospital, a pediatric and maternity health hospital in Barcelona that you may know. And we've been running different strategies in liquid hospital and digital transformation. So we'll try to bring our experience on that.
Thank you. Nuria?
Yeah, so first of all, thank you so much to the Barcelona Health Hub for organizing this event. I'm also very happy to see some faces again. So I am Nuria and I am the CEO at Human IT Care. We are a company based here in Barcelona, but working in Spain and also in other projects in Europe. And from those people that you don't know Human IT Care, we are working in the remote patients monitoring space. We are working with both public and private hospitals or healthcare insurance, and it has changed. I have to say that we will later discuss, but also we are experiencing now some of the challenges that I am sure that we will talk again. And my background is in clinical psychologist. I have a master in neuroscience, and I was working in the Hospital of Mar, in the Research Institute of the Hospital of Mar, as a research assistant, and then later I led some projects involved in digital health. And I see, together with the other co-founder, that the need, it was there, and yeah, we founded Human IT Care now 4 years ago.
Thank you. No, I think that we have great different points of view to discuss, but before starting, I think that it's important to ask you, what do you understand as the liquid hospital concept? So to set up a little bit the discussion. You want to start, Patricia?
Yeah. Well, for me, I think a liquid hospital, it's something different that probably the persons who work in hospitals think. For me, it's something that it's a different way of thinking, because sometimes a lot of people think when they think in liquid hospital, they think in technology, input in technology, and I think when we think in liquid organization, we can talk about hospitals, or we can talk in organizations. We have to think in a different way of working. We have to talk about asking process. We have with this working with patients, and we can see also in Sant Joan de Déu that they are working like this. We have to work in a different way with persons, and also we have to work basically in a human way. For me, this is a liquid organization and also a liquid hospital. And of course, we have to use technology, because I think it's the way to arrive, but it's not the only way to arrive. For me, it's more important to use the human way to arrive to these liquid hospitals.
Sure, totally agree. And
yeah.
Maybe, Cesar, you have some ideas?
Yes, well, from our point of view, you know, as an insurance company that works exclusively in the area of the medical liability, I would like to, and related to the liquid hospital, I would like to point five important points. One of them is changes in the epidemiological profile. We are moving from an acute patient to a chronic patient with more disease and more fragile, so we have to take that into account. The second idea is the modifications in the social configuration. Society is much much more demanding. They also have more information, and also they have more criteria to make decisions. So that is also very important. We have introduced the concept of self-care. The third point is it's concerned to the sustainability. Hospitals are expensive, and we could be spending less on burdensome means. The fourth point is the new technological tools. We have now this technology allows us to keep the patients safely out of the hospitals. Now we can have information in real time. Even more in those patients admitted at home from those admitted to the hospital. And it's important to know. And the last point is we are facing a new business model. Healthcare professionals, they think that their job is unique and special and that it cannot be changed, while other sectors like banking or insurance or care have changed the model. So we have to think also in that movement, you know, and that should change, no? And for the end, for me, the liquid hospital consists of decentralizing the healthcare provision from hospitals to community to primary and to home care.
Okay, good. No, you raised a lot of points. Arnau, well, you have already experience making Sant Joan de Déu a liquid hospital, so I'm sure you can bring some more ideas.
Yeah, I think to complement what my colleague just said, we created the first project of liquid hospital in 2010, and the objective mainly was to go beyond the walls of the hospital, so try to not make the health so paternalistic as it was, and try to make it more collaborative so that patients can be involved, can take part on the decision making, and health not only should be presential at the healthcare site, but whenever or wherever the patient is. So that was the main objective. So we try to create the tools taking into account patient first and the journey and professionals that can help them be more involved in that way. Also, we have the situation of being a pediatric and maternity health hospital, so our population is young, and that's something that pushes for a change. So we live in a digital world, and we think we have to change and rethink the way we provide and deliver health. So for me, that would be the objective, be more ubiquitous and efficient on the delivery of healthcare.
No, thank you. Nuria?
Yeah, so for not repeating what my colleague has said, I like very much this idea of decentralized, because in my opinion, it involves that the patient has a responsibility and an active way to really be involved in the process. And yeah, well, from the concept of liquid, this first concept was said by Bauman, which was one philosophy. So for me, this concept of flexibility, it is also involved in optimization to better improve also the way that we are delivering healthcare. We all know that the public healthcare is unsustainable because it has a lot of expenses, and this, for me, this meaning of liquidity means also this flexibility to improve and optimize how we do the things in medicine.
Thank you. No, to go a little bit deeper, and you talk about it already, what are the benefits for the patient? Because at the end, what we want is a better healthcare and the patient to have a better experience. Mm-hmm. Maybe, Cesar, do you want to take the first shot on this one?
Yes, of course, thank you. Well, the patient, I think that the benefits for the patients are quite clear, because when we take part of the system out of the hospital, from the building of the hospital, and we move closer to the patient, we are gaining many, many things. That getting closer to the patient is more important in terms of humanity, in terms of confidentiality with the patient, with the family of the patients, And I think that the professionals also feels that their job is changing, they feel more recognized. So, you know, both gain in this movement out of the hospital. So I think that the patient is really the ones who gain in this new relationship that we would like to have in the near future.
Arnau, do you have any more thoughts on the benefits for the patient?
Yeah, I think not everyone is the same. Everyone is different, and also in the daily life of every person. So having a capacity to be more, to personalize more the healthcare delivery that we have, and accompanying the patient not only in the acute care, but from home to home, so in prevention, during the acute care, and afterwards. And with the tools that each patient needs, I think that can only be a benefit for the patient. So trying to segment more the type of healthcare that we deliver to each of them. And I think Liquid Hospital in it also have a way of thinking from the patient. So taking into account the journey and each patient needs, also the professionals, and on top of that, try to build a system and a solution that fits each situation.
No, I agree in this point. I think that no patient wants to be in the hospital by itself. I mean, they want to be at home, but it's a great way to extend this treatment to their house. And Nuria?
Yeah, here I also want to add something. When we speak with patients and doctors, and maybe some of you have experience, the first thing that they say, oh, but this concept of digitalization, I don't want to lose the contact with my doctor. I want to see the face. And speaking last week with some group of doctors that they have experienced telemedicine during the pandemic, they told us that for some patients it is very important to have this face-to-face. So for me, in this process of Liquid Hospital or digital transformation from the hospital, it is very important to not lose these needs that the patient have, because we know like that some of these meetings are also like a therapy for these patients to see physically the doctor. So for me, it's also like a kind of hybrid combination, and here we have to listen to the patients. Yeah, always.
Sure. Patricia.
Yeah, but I think here we are talking about liquid hospitals, but how many hospitals are like this? How many hospitals are really liquid? We know Sant Joan de Déu, but the rest of the hospitals, they want to be liquid, they put in their objectives, their vision, they want to be, but really, how many hospitals are really working with patients, like Sant Joan de Déu, that they work really with patients, and they have a chief patient officer, for example, or they work really with patients to take decisions, and they start to work from the beginning with the patients, with the ideas of the patients, to the patients what they want. They are all the time saying to get a real contact with the doctor, to arrive to understand the doctor, and to have a human relation with the doctor in a traditional way. Then with telemedicine, they are going to arrive to have this real human relation. Then we have to work these soft skills with them, this digital empathy. And I think these things, we have to start to work from the beginning also with these digital startups, with companies like Nuria, with patients, to start to work how we can improve this relation, and also with the doctors, how to improve the capacity to connect in a digital way. Because if not, we are going to be worse like we start.
No, I think it's a good point. I mean, we are talking about tools. By itself, it's nothing. I mean, you have to use it right. I think that you all raise really interesting points. Going a little bit even deeper into that, regarding the patient experience, because I have been saying that many times. I think the patient experience in healthcare, it's the worst experience as a user that you can have in any industry. So I'm sure that we all see improvements there, but what with the concept related to the concept of liquid hospital, what should be the improvements? Not always be, but should be the improvements. Maybe Arnau, do you want to get the first shot, please?
It's a good question. I have to say that we have experts on patient experience. I'm not, but I will try to answer the question. I think it's having patient first, so thinking on them and trying to involve them on the process of definition and design. And not only, now talking about pediatrics, not only about adult and families and patients, but also pediatric patients. For example, we have a group in San Joan de Déu, it's the Kids Barcelona, are kids from 12 to 18 years old that are trained and involved to help on processes of clinical research or innovation. And in most of our innovation projects, first we start by asking if the unmet need, the proposal that we have, really it's how they see it and if it's really a problem and the proposed solution if that fits that. So I think any process of innovation or implantation of a new have to take user first, and in that case in healthcare that means professionals and means patient also.
Sure. Nuria.
Yeah, I agree with Arnau, and I also like one thing that he told before, that all of the patients are different. Like we are going to be patients, all of us, and we are different. So for me, in my opinion, it's very important that the organizations are now thinking into the application of this concept. So we need the right roles inside of the organizations that ensures that this change is real. And for that, for example, last week I was in one hospital in the north of Spain, and they told me that they have implemented telemedicine and different solutions, but they lack of the roles that leads inside of the hospital this kind of implementations. And I am not talking about a project manager. I'm talking on a role that really ensures that the patients and the doctors are really they really want that. And this is very important. In the United States, we have a lot of examples of digital transformations, chief patient officers, and different roles that are needed. And if we want to change, we need to change also the roles on the organizations, and we need to start thinking in different ways. And also, another thing that I think is important is the attitude. The attitude of the management team, because if we really want to implement and if we really want to innovate, the attitude and the open mind, it's also very important, and I think that it's a change that organizations have to done, and the roles are very important for the good success of these implementations, in my opinion.
Patricia.
For sure, I'm very agree with Nuria, because if you don't change the mind how you are working, you are not going to arrive to where we want to arrive. I think it's very important to see where they are working like we want, like other countries, because we have a lot of examples where they have put a chief patient officer or another person. It not has to be a patient, but someone that it's linking this innovation and patients and doctors, because I think the organizations in the hospitals are always doctors. And I think sometimes the doctors knows to do medicine, but they probably don't know about organization and about transformation, about digital. Then probably we have to change a little bit and make something more horizontal. I don't have the name now, but something more transversal, okay? And then we have to make more team management, and then it's going to be better for the organization. And another thing that I want to add for the improvement of the users, of the patients, or all the users, because I think it's patients and the family of the patients, because I think it's very important, because we are talking about kids, but also in other disease, we have the family. And then we are sometimes forgetting these families. And then I think we have to get the space for these families, and then we have to ask the patients and the families what they want and what they need. Probably when you ask, you don't get the best solution, but when you start to work with them, you will try to find together this solution, the best one.
Cesar,
Well,
do you want to add something else?
yes. Difficult. Okay. Yes, there are examples in other countries like Kaiser Permanente and other ones. But in my experience, I remember when we started with the School of Patients in primary care. And that was, I think, that should be the starting point of these, as we said, this centralization of the hospitals, no? Because if we don't make that movement to primary, and putting the doctors, the nurses,
yes,
with the patients and the family of the patients, and start working with the same goal, I think we could be talking, forever, sure. And we have to start with something, no? And I think that we have to push, the system, the actual system, in order to move in that direction. That is a good direction. Sometimes it's they forget, because it's difficult, it has to be with the persons that are involved in the project. You find one doctor or one nurse that is, very, how to say, worry about the patients, and start with the project. Then when she or he left the project, die, at the second day. So it's important to involve both the organization and to take this example that we already have, and don't forget that, improve them, and also push with the system, in that direction. I think so.
Well, I think, please.
No, just a little thing. It's important to start in this way, but at the same level.
Of course.
It's just important,
Of
because
course,
if we are with the School of Patients, but we are not in the same level, the patients, the doctors, the nurses, and everyone in the same level, because
that's the key.
That's the key.
That's the key.
Yeah, we agree.
Absolutely agree.
Yeah.
No, good. And I think this leads somehow to the next question that I would like to ask to all of you. What do you think that now this is good for the professionals? Because, well, we have the two sides. We have talked a lot about the patient. I think that you are right. I mean, we should involve more the opinion of the patients, and the experience should be an objective in any healthcare provider. But we have the professionals there. They have to adopt these changes. So, Nuria, you want to start with this one?
Okay. Yes, so I think that it is also like difficult maybe to answer in one sentence. What I am sure that for the doctors is that they don't want to have extra work done with all of these new technologies. So they want to, as all of the workers, they want to do things simple, right? And in some cases, this kind of technologies have a learning, have a formation, and they have to start like doing new things and also like changing new procedures that they do. So for that, it's very important also to ask them. And Patricia has said very well, I think that these groups of, before starting implementing, we have a lot of experience, and you have said before, and you have showed the report of McKinsey that explains very well all the advances that during the pandemic we have experienced that are very good. It's a new wave, as you have said, but we don't have to forget that these doctors are workers also, and they are using the technology, and this technology has to be at work to do it. It has to be implemented in the workflow of the process of the work. For example, telemedicine has to be counted as a visit, and also we will maybe talk later about the legislation, but it has to be in the workflow, right? And well, with some doctors that I speak from different parts of Spain, they told me that it has to be implemented in the workflow, and it doesn't have to be an extra work for them to really like do their work.
Patricia?
Yeah, for me, I think, of course, we have to start to work with doctors like I want to work with patients. It's asking, asking, and asking. Okay, we don't have to suppose what they want. Okay, but I think it's very important to see what is the situation. Okay, we see, and after this pandemic, we see like we have a lot of burnout in doctors. Okay, and the situation is that they have no time for patients. Okay, and they want to have more times for the patients. And I think the solution is not technology. The solution is to give more time in a quality time, okay? And I think how we can do this, let's talk and let's try to get the solution, okay? And I think if we start from the beginning and talk to the doctor when you start your career, when you start to learn medicine, why you start this, okay? And what's your motivation, okay? I think 80%, they said, I want to be with the patient, I want to arrive to a solution, okay? And then when you change your mind, normally they said in the third year, okay, when they start to work in the hospital and they see the other colleagues, how they work with the patients and the way of working with the patients, then they see how they work and they work like the other ones, then they change the way of work, okay? Then we have to start from the beginning, back to the basics, like we say in marketing and everything, then back to basics, back to the first year of medicine, and then back to this point and start again and start to think, okay, back to the patient, and don't think how you work it with the patients in the hospitals and start again, okay? Then rethink about it and take the point of view of human. And I think if we start to work like this, you have to, I don't find the word in English, reaprender, to
relearn.
Relearn, yes, okay, it's easy. Relearn, you have to relearn. It's not easy, but I think we have to relearn.
Okay, well, just one thing. We are getting short of time, and we have a lot of topics to go that are really interesting. I would appreciate if you keep shorter your responses, so we can do it more on a flow. Cesar, please.
As I said before, one of my points was a new business model.
Mm-hmm.
So this means that the healthcare professionals, they have to change their mind. And as a society, we should make this mandatory for them. Okay, we're talking about the patients, but if we talk with the healthcare professionals, they are, you know, I don't know if they are really aware of what's going on, you know, outside the hospital, outside the system. No? So we have to start, you know, in some way pressing the professionals to change, to move in this direction. If we are waiting, you know, until they figure out that this is going on, maybe it could be late. So, you know, also with the patient, but with the professionals, and, you know, making the biggest effort as possible to move them to change, to rethink or to relearn how they are delivering the care to the patients, and always, you know, in this direction.
I don't know, you want to add something? I think this is a very touchy topic.
Yeah, I think it's a good point. I think it's a challenge, in fact, what's the professional on that. And that's because I think all the things that we are talking now, all the examples that my colleagues mentioned, at the end touches one point, which is that a liquid hospital, at the end, it's about organizational change more than technology or other things. So that's one of the challenges. And we've seen that in the last 20, 25 years with the implementation of the EHR, professionals now dedicate more time to writing or after each visit than looking at the eyes of the patient. And I think that's something that we have to learn from that and try to change when we implement a new service or a new way of treating patients. Also this workflow and how to teach also professionals how to deliver this new way of treating patients.
Good. So, talking about real experience, I would like to ask you what your real experience on this concept happening, because we have talked about it. I mean, it's new, it's happening, it's hard to happen because we have a great inertia from the system, and I understand. I mean, healthcare professionals are stressed, are overloaded, so asking to change, I mean, it's difficult. But what is your experience in the Liquid Hospital? And please keep your responses short this time. And to Patricia, you want to start this?
Okay, I can start. Okay. Yes, I have to say, to be sure, that we have all the experience in our website. In the blog, we always try to put the experience of doctors and patients, so you are invited to go to our website and see it. But just to be very short, so that people can also speak, I think that in our experience, we have seen that before COVID-19 and after the pandemic, there are like some hospitals and doctors that are very aware that it's important for them. And of course, there is like a lot of challenge, starting for, as Cesar said, this new business model that it represents for the healthcare, because it's new. And here I have to say that the private hospitals or insurance that we are working, they see, and as they have this strategy it is easy to implement. And here, for example, with one private group, we have experience, and it is a pillar for them. And then the implementation from the hospital, it is important. Also the interoperability, that is something that I know that we will discuss later. But it's important, and it is something that it is something that it can done if the strategy from the hospital has this attitude. But for the other side, that's true that in the public system, we need to redefine and there is like some procurements on this, but I think that it's something that we need to still work in, because we need a strategy, a public strategy for that also.
I want just add something that I think that we have to be aware the dangers. Okay, I think it's very good to put, for example, technology in this case. Okay, but something that it's very dangerous, for example, it's you can put an app to see the results, for example. We were talking yesterday dangerous to go to the results, just to put on the table.
Okay.
Okay, in my case, my personal experience, short. You know, at the beginning of the pandemic, I was the manager of the hospital in Córdoba, of San Juan de Dios. Mm-hmm. And imagine, you know, that time in the hospital. And we made some movement in those moments when we had full, the hospital was full, and we need to treat the rest of the patients that couldn't come to the hospital. And as in this case, with the philosophy of the Order of San Juan de Dios, we decide to go out of the hospital and start to treat, to do home care, delivering home care to our patients, to those patients. So this is possible. This you have to come with the professionals, but if they see the benefits for the patients, and the patients are also, you know, involved in this new business model, you know, there is light at the end of the tunnel, of course. Mm-hmm. It is.
Good. Arnau.
Good. I will explain one example. We had many initiatives going to that, involving professionals, even connection with other hospitals, involving patient and moving to patient home with the patient portal and other initiatives like websites to make them involved and give answers. But I will focus on one, which is diabetes type 1. We started the Liquid Hospital in 2010 with that, creating a website, a different way of treating those patients, and trying to provide them information so that they can be involved in their own care. Diabetes mellitus have an advantage, which is that it have a really clear outcome to see if that's going good or bad, which is the hemoglobin. And in that case, what we've done during these years is to try to segment the patients so that we can deliver to each patient needs and profile a more concrete way of treating themselves. So not all have to have a glucometer or a pump, so with a closed loop. So during these years, what we've seen is that by segmenting patient needs and providing each of them the technologies, the treatment that they need, the results and the outcomes improve. And now we are moving to a point in which we created a cortex, so a command center, like a contact system in which from the hospital you can contact the patient. And the objective here is that we can have new roles like the nurse, digital nurse, that will take care of those patients at home while they are not in the hospital. So that if normally a diabetic patient will visit the hospital 4 times, those patients that move well with technology, that have family involved, maybe they don't need to come 4 times to the hospital. Maybe with 3 or 2, it's good, and they are better on their results. Otherwise, on another case, those that are not so stable or are in adolescence and they are less stable, maybe they need to come more. So by segmenting them and providing each of them a different way of treatment, you can have at the end the same visits a year in general, but better outcomes per each of those patients. But of course, that needs a lot of organizational change and business model around it to make it happen.
Yeah. No, and this brings to the next question, and I think that we already somehow responded. I mean, the next question is this is happening? And somehow it's happening, and you have named it, but I think that it's better that we jump to why it's not happening so fast, because we already agree that we have benefits for the patients, that we have problems bringing that into reality of the hospital, but maybe you have more clues on what are the stoppers, what is happening, why it's not evolving this. And we already mentioned, but I don't remember whose turn was that. You can start.
Yeah. I think it's not easy to start with this kind of organization and to change the mind. It's different in public sector or private, let's see, like something like Sant Joan de Déu. It's not private like private, but it's more private like not a public one. Okay, it's very different to work in this kind of hospitals. Then I think it's easier. In the public one, it's not so easy to change the organization. And I think another reason that it's not working, it's because it's not changing in the organizational team. Okay, they are not changing the way of thinking, and for me, it's the key. Okay, then if you don't change the way of thinking, the constant feedback, the active listening, then you are not changing. Yeah. For me, it's key, just to be short.
Well, we have to think in the long term, and that's one of the most important things. This is not one-day work, no, one-day job. So, and our politicians, are used to only to see, in the short, or even more, or even less, in the short term. So, this is, I think, the main problem. But as society, we have to make them understand that, health is one of the most important, it's the most important for life. So they have to occupy in this transformation, and this new model. Don't say business, just say care model. So, and we need to keep pushing, as from, every one of us, and try to make them understand that this is the way of delivering the care that we want, that we need, and that we will need for the future.
Yeah, I'd say that that's a cultural change. That's one challenge. Organizational change is a challenge, but at the end, if reimbursement don't goes with that, change will difficulty happen. So I think instead of being a pusher of it, it goes a little bit behind, and it's difficult then to reimburse some of the treatments of digital health that we are talking about. So until we don't have it, and there's an opportunity because that could be a pusher of this change, it will be more difficult.
No, I totally agree, and I've seen that in reality happening. I mean, you go and you see this is much better, and they say yes, but I will not get paid for that, so I will not do it. Yeah, that's a very interesting point.
Yeah. And just to add a new point of view, we don't have to forget that in other countries it is happening. So in a massive way, there are like countries as United States and other countries that has the legislation that allows them to implement that in a very radical way. I like very much also the point of view of Cesar. He says that it has to be a process that has to be changed for all. And this vision also I share with some of the hospitals that we are working, that I see that they bet for real innovation and they change all the process. And of course, it has to bring a learning from the organization, and it has to be a process. But at the end, it is happening also in other countries. So maybe we have to think what we can do here to really make it happen.
But yeah, you name it. I mean, regulation is an issue because regulation is a big constraint in many innovations. Well, we publish it in the hub. All what we see as the change that should be done to enable telemedicine in this country, which is not fully. We don't have the full ability to provide telemedicine in a natural way as it's done in other countries. So, well, framework in regulation. What do you think that should be changed or we should address to become more, to see more hospitals go liquid?
Okay, it's interesting because I think that we have different speeds. You know, the innovation is going fast, very fast. You know, we as an insurance company, we invest in other companies with innovation products, and we try to bring those products to our clients, and sometimes we are much ahead of their speed. So, as you say, this different speed it's a problem. It's a problem. So that's another point to work with the government, to be more aware of what the industry, the innovation industry needs. We need a framework, you know, as fast as the innovation goes, and that's a big deal. And you know, hopefully, you know, in the future we will have that. But you know, we have to ask them to go faster.
Now?
Yeah, I absolutely agree. I think regulation and development of new technology needs to put everyone in place, so government, academia, industry, and patient and population to make it happen. And now I think regulation, it's needed, of course, also in data, that now talking about digital health mainly is in data and data protection, but we should find ways of creating sandboxes or spaces that are protected enough to accelerate some of these solutions to get to the patient and to the market.
And also for adding something from another point of view, it's true that the technology it's going like very fast and regulatory is not there, but also the people the companies that we are working in technology, we have to fulfill like all the compliance and all the regulations. For example, the CE mark. If we are like putting any insight from the patients or others as the GDPR or HIPAA compliance. So that's something that maybe it's needed to have this formation and these implementations. I think that the technologies companies, we are working in a very serious space, which is health, and we need to fulfill all the things. And the most important also, we have to show evidence of the things that we do, that it is not, well, sometimes regulation involves that you have demonstrate evidence, of course, the CE mark class 2 and others, or 1. But I think that it's important that from the other side, the little regulation that we have, that we, of course, fulfill all the requirements that they ask.
Okay, so you want to add something?
No, I think everything is
good. So, well, moving to another big deal, which is public offerings. I mean, of course, private hospitals can do their job, and I think they are doing it well, I know from direct experience that they are thinking about ways of doing things different. Maybe in the public hospitals we have another constraint, which is that everything has to go through a public offering. And this is a big constraint. And I don't know your thoughts about it. Arnau, you want to start with it?
I agree. Of course, there's challenges. I think also there's some solutions to be in place, like the public procurement and programs like that to try to accelerate this. But I think there's an opportunity. So the capacity and the resources of the public system could be a pusher for the change, and creating more initiatives like the public procurement, for example, so that can help accelerate all this change and be applied on the public system. And also there's an opportunity on what Cesar was explaining at the beginning, on the connection between primary care and tertiary complex acute care in hospitals.
Yeah, here for me, there are two important things. The times are very important in the implementation of any technology, and in my opinion, the public offerings kills this implementation, because for a technology company, 2 years, maybe we can launch different products or 3 different products, and the times are very important, and the public administration has to listen and also see what are the times for also the development and implementation. This is the first thing. And the second thing, I think that the budget has to follow any kind of a strategy. So for me, to buy medical equipment, in my opinion, is not just that. So it's not like a digital transformation. So maybe the strategy has to be very oriented and aligned with technology development, because these kind of public procurements, they are also thinking in some regions for innovation, and it has to bring real innovation, not equipment itself.
Sure. You want to add?
No, I think probably you have to rethink the procurement you are getting, because probably you have to add something, not probably the point of view of the patient, but probably the results of the patients in there. And then sometimes you are only putting the price first, and probably you have to change this.
Oh, sure. And some of the things that you said reminds me of my old job. I was in the food industry for many years, sorry. And at that time we had the factories, and we had the sales team and the marketing team. And sometimes you feel like they work against each other. Because, of course, the factory wants to have the best product, the lower cost, and this may not fit well in the market with the sales guys. And somehow I see these ideas in the things that we commented. I mean, we can put the focus in the production and in the cost, or we can put the focus on what is the expectations of the user. And it's difficult to balance. Even big companies have challenges balancing this equation, and some companies are clearly to one extreme and others to the other. But I think that in healthcare, we are more on the outcome-based service. The important is the outcome. So, well, we are reaching almost the end. We have some questions from the audience. Please try to be really quick so we can go. What would be the best approach for a hospital to go liquid? This is a question that was launched. I don't know if any of you want to take it.
To put a patient.
To be patient. I think to be patient is
to be patient
important.
and to work with patients.
So, also, well, they already talk, and they made me think about this manufacturing and double sense in all of these. But also, they talk about if you want to give some concrete examples that happen here with the Liquid Hospital. I think that we already commented some of them.
I can add one if you want.
Okay.
We are working in heart failure with the Hospital of Torrevieja, and in that case, the patients that are in readmission, they go with a pack of devices, of medical devices, and they get monitored at home. And here, I think that it's very important in this experience because one of the main things that we have experienced are mainly three outcomes. The first of all is that we have demonstrated that this unit can reduce 33% of the visits to emergency, and this study is published, so you can find it. And the second one is that the data that is generated outside of the hospital, it is reused for taking a better insights and a better clinical decisions, and this is important. So we are using an opportunity that were missed. And finally, that the patients, that most of them are elderly, they can use it. There is also like a lot of stigma of elderly people, but elderly people, well, it depends on what elderly people you think it is, but they can use it and they want it.
Good. So to finalize, please provide your advice to the industry, to the people that we have here. What should we do to go forward with this concept of Liquid Hospital?
For me, it's three things. Don't get excuses. Change problems into opportunities, because we can do it. And at the end, work in a human-centric way with patients, of course, because you can put an excuse that the regulation, that you cannot work with patients, you can work with patients and you can change the way of working.
I think that for me is that we have to have an holistic view of the system, you know, and try to make that a common vision, and see, you know, what's going on and what we want to happen for the future, and how will we be treated, you know, and you know, if we sit down and talk about it, this could be the first step, no? Maybe now we are very apart one from the others, and we have to, you know, to get closer and to talk, you know, firmly so about this situation, and making plans for in long term about the care.
Yeah, for me, there's an opportunity here of efficiency, of better delivery of healthcare, and improvement of patient experience. So I think it's as I said, an organizational change that needs to ask patients, to ask professionals, and put all the people there. And start small with some examples and then keep growing, taking into account what outcome you want to achieve. So also adding this part of analytical view on that.
Yeah. For being because we're out of time, very quickly, results and evidence are there, and it has demonstrated the value. So now I think that it's a time to shift the mind and to really like implement it and implement it in the workflow of the hospital.
No, thank you very much. Thank you for your contributions. I think that was very interesting. We raised a lot of good ideas, and I'm sure that a lot of people enjoyed this discussion. So now we have to move forward with the agenda, and we'll leave it to Elena to continue. Thank you very much.
Thank you.
Thank you, but before, Christian, before, if you don't mind waiting here, just for a family photo, maybe just right there with the VHH Summit on the backward. Yes, that's all right. Okay, just smile because we are celebrating that we can stay here all together. And yes, thank you again for this first and very interesting first panel. Thank you very much, Christian. And as you said, it's time to move on with this. Well, we continue with the digitalization of the national health system. You know, COVID-19 has raised a new context in society. The digitalization of the health sector has become, in the current circumstances, a necessary and a complementary tool for making our healthcare model much more efficient. So, you know, the digitalization, it has a direct impact on patients by saving time and unnecessary journeys. So AstraZeneca will show us a pillar for facing new challenge. In these terms, please let me introduce Carlos Perry, Director of AstraZeneca Foundation, and María Gálvez, CEO of Plataforma de Organizaciones de Pacientes. So Carlos, María, thank you very much for being here. Good morning, and the floor is yours. Hello.
Hello. Hello. Good morning. Yeah, perfect. Okay. So, hello. Good morning to all. Thank you very much for coming here today and to being here with us. We are going to talk about telemedicine and about the importance of digitalization of the health system. And for doing that, we cannot have a better. I cannot have a better partner here on the stage than María Gálvez. She is the president of the Patients Platform organization, and I would like to thank in a special way to Maria for being here today with us. For AstraZeneca Foundation, patients are crucial for us. We work for them, we work for them to improve their life. So to work really close with them to improve the care system model, it's really important. And that's why when we received the invitation, we have decided to organize this panel with Maria to give the opportunity to the organization that Maria represents to share with you the ideas on digitalization, because it's really important that when we talk about digital health to take into account what the patients think and what they need. No? It's not only about what the system needs or thinks, it's also about to listen to them to improve the system with all the ideas together. So, Maria.
Thank you, Carlos. Thank you, AstraZeneca Foundation and Barcelona Health Hub for inviting us to be here to share with you our vision about digital health and specifically about telemedicine. Let me introduce you my organization. And we are the Spanish Patient Platform, and it's an umbrella organization which brings together more than 1,500 associations all over Spain. And we together work on three main areas. The first one is to defend the patient's rights. The second one is to support patients and their families in the patient journey, from the diagnosis to all the journey of the disease. And the third one that is linked with this project is to build a better health system, to contribute to improve the healthcare. So in this context that we are through, we realized that we have passed from almost 100% of face-to-face consultations to more than 50% of telematic consultations. And we knew, because we did a study about the impact of the COVID in people with chronic diseases, that both patients and health professionals were unsatisfied with this type of consultations. They didn't have any guide, or everything was like they had to manage with the tools that they had. So we decided to work in a project that set the basis to a telematic model center in the patient's needs. And we asked AstraZeneca Foundation to join us.
Yeah, and that was my first question, no? Which is the main objective? Why you have been working on this report that you have launched this week on the 26th? It was the presentation.
Yeah, we realized that the health professional and the patient had troubles to use these telematic tools. They didn't know how and when and who have to use, and we wanted to give them tools in order to improve this healthcare that patient needs.
And the second question is how you have been working on this report, how you have made this report.
Well, we have clear that we need all the approaches. Of course, we have the patient approach, but we also invite to participate the health professionals and also the regional communities, because we wanted to know about the approach of the administration. For us, it's important. So we did we used a qualitative methodology, and we did 3 phases. First, we did a benchmarking between different European countries, because we were interested in how they were implementing telematic model. Then we listened patient and health professionals by focus group, and finally we launched a questionnaire for regional communities. So with all this information, we were able to make proposals.
And the main conclusions of this report, can you share it with us, please?
Yes. So we had 10 proposals. I'm seeing that we don't have enough time.
You have 10 minutes to explain.
I can share with you 5 of them. The first one is that we need a legal framework. There is a need to develop a security and privacy and data protection regulation. We need that this regulation have to be clear. And this is the first step. And we are working with the Ministry of Health in the National Digital Health Strategy, and we are working also in a quality normative or something, also to set the basis. The second one is to establish some criteria for the use. As I mentioned before, we need to know the when and the how and the who. Telemedicine is not for every patient. It's not only because of the clinical situation, but also for the social context. And I think this is important. We need to know the social context of the patient, and this is important for clinical too. So, and we, in this point also, we have to let patients to choose, because we also always defend that the patient have to be more autonomous, and they know if they need online consultation or maybe they need just a face-to-face consultation. So some regional communities have settled these kind of opportunities for patients, and I think it's a good way. So the third will be that we need to reorganize human and technical resources, is not only to invest in new technologies, but also to define new roles, new professional profiles that can answer the challenge that we are facing now. And the fourth, I have 5 seconds. The fourth is to coordinate social and health. This is like, I think we have a big opportunity here to coordinate health and social systems, and to integrate all this information to have an holistic view of the patient. One of the colleagues that was here before said that, and I think this is really important. and we have the opportunity now, so we have to do it and to do it well, and to because this information will give us the opportunity to give the patient a better care. And finally, we need to train patients and health professionals, not only in technological tools, but also in how to communicate. It's difficult to communicate by telematic tools, and patients and health professionals have to know different ways. So.
Okay, thank you very much, Maria. And I forgot to say something really important. Thank you to Barcelona Health Hub for organizing this conference or this meeting today. Thank you very much.
Thank you.
Thank you very much, AstraZeneca. As you said, Maria, we have a countdown here. Just no pressure, but thank you. You can leave the mics here if you want. Thanks. Yes, if you want to just come here.
Covering up your tracks. Spend all your days running away. You got to watch back.
That's right. Okay, thank you very much. An applause for Carlos and Maria and all the information. Thank you. And, well, now it's time to start with the first round for the show and tell sessions. Remember our famous 4-minute demos of technological solutions. So we are going to start with first 7 companies that each of you will have your 4 minutes of glory to explain the work to us. Remember, 4 minutes, that means, as Maria said, you have a countdown here in front of the stage, so you can follow the time, because we need to be just very specific with these 4 minutes, right? Let me introduce the first company, which is VR Pharma. Mireia Cigarran is a co-founder and CEO of VR Pharma. And what is VR Pharma? A company focused on enhancing patient care and well-being with virtual reality. She will be presenting their solution to bring hospitals, medical centers, a scalable, effective, and sustainable way to improve their patient's state of mind during treatments. So, Mireia, whenever you want, here you are. Welcome on the stage. Here is your mind. The floor is yours. Yes, this is you. And remember, thank you.
Oh, yeah. Thanks, Elena. Okay, so I have a question. How many times have we seen nurses and parents hold their young kids so they can stay still, so that we can insert an IV? How many times have we seen young children live traumatic moments in the medical setting that shouldn't be, crying and kicking? How many times have we seen patients be overwhelmed by anxiety and pain? What if instead we saw them calm, we saw them smile? One last question. How many times have we heard that emotional well-being is 100% related to medical recovery? Virtual reality has been proven with hundreds of medical trials that it's both effective and safe to treat anxiety, pain, mental health, even decrease opioid usage in certain moments. Also, there is initial data that it can help us reduce the expenditures of hospitals. Still, we don't see it being used in the general medical setting. Why is it so? There's many reasons. One of them is implementation barriers. Today I'll share 2 of them. First, time. In the medical environment, we see emergencies. On top of this, there's a lot of medical and personnel shifts and movement. There is no time to train them, all of them. So technologies must be so simple and easy and intuitive to use that it almost requires training free. Second, the patient. We cannot expect patients in pain and distress to learn all these new technologies. Technology must be adapting to their needs. It must be comfortable. We need to understand that maybe the patient in the hospital is laying down on their belly, having a back treatment. Maybe they are in a surgical environment. Maybe they are 4 or 70 years old. Contents and technology must be patient-centric. At BR Pharma, we have tackled all these and other problems we find in the hospitals in order to commit to our mission to democratize the use of BR in the medical environment. This is why our solution is free of internet, portable, and very easy to use. In fact, thanks to our solution that with external device you can control the BR experience of the patients, we can bring BR to almost all patients in everywhere of the hospital setting. Also, we are creating this first digital pharmacy with different BR contents that target different aspects for the patient. Some pills target emotional well-being or patient empowerment. Some others target pain or anxiety. With many clinical trials that we are supporting, we have our first initial data run by German Stiriasi Pujol Hospital, in which we reduced by 9 points the stress and anxiety of doctors and nurses during emergency rooms during the pandemic. We can see how BR is impacting positively our patients. We can help nurses and doctors provide this better care. And now just close your eyes and imagine. Imagine the future of this hospital. Imagine the patient-centric hospital we all want. Now imagine BR implemented. All of a sudden, inserting an IV to a 6-year-old is easy and calm. All of a sudden, we can bring an 80-year-old woman to the mountain and teach her breathing techniques. And why not? All of a sudden, we can accompany a man in his final stage of life. All this is possible. It's a reality. Empowering patients, it's a reality. Reducing traumatic moments in the hospital, it's a reality. We can have this centric patient hospital we all want. Thank you.
Thank you very much, Mireia. Let's continue with Qualoot, a digital innovative company focused on creating healthcare digital products from the user experience approach and humanization focus. Here with me is Eudald Mas, his CEO. So, Eudald, the floor is yours. Do you need? Just pressing here. Thank you.
Thank you. Thank you. Hello, good morning. Thanks for being here. My name is Eudald Mas. I'm the CEO at Qualoot, and I'm here to talk about healthcare digital products from a user-centered perspective and a humanization focus. I'm here to talk about Qualoot, your healthcare digital partner. But what it is exactly, Qualoot? We work as an agency, as an innovation, design, development, and research agency, but we also have our own projects that I will tell you later. And why the healthcare sector? As you have seen, there has been a lot of lacks of digitalizations in the healthcare sector during the pandemic. So we propose to accompany those healthcare institutions in their digitalization processes in order to solve their real problems. In order to do that, we work on the research as a base of innovation. We work on the design in order to create unique and great experiences. And we work also on the implementation of technology in those institutions. And how can we help? We can help on research, validating and testing the ideas, the concept, the prototypes. We can work on the design, on the UX and UI part, in which here I want to point out the humanization processes of the tools that we are using and also the gamification of the tools. And finally, the development, in which our approach is an API-first approach in order to be interoperable with all the other solutions. Why? Because we think that we are in a great ecosystem and we have to all work together in order to create synergies together and great impacts on the sector. These are some of the companies that we have been working with during the last years, and we aim to be in the middle of the triangle of knowledge between business parts, startups, companies, healthcare, pharma companies, consultancy firms, also with the research part, with the research centers and hospitals, and finally the education, the universities. At the same time, we have been working with several projects, our own projects. This is one of them, Tonificat, which is a gamified and personalizable platform that is used to monitor and assist the treatment of patients that are going to be operated of a gastric surgery. This is already in a pilot stage in use in the Hospital Vallebron. And also, moreover, we have Laya, a platform that to accompany women during their motherhood in order to assist and prevent the mental health disorders during the motherhood, like, for example, postpartum depression. This is going to be launched at the end of this year. So this is the founder, the core team. We have a UX UI lead by Adrian. We have also the medical part, Irene, a psychologist, and we also have Rainier, the CTO. So we are all waiting for you in order to create something extraordinary together. Thank you very much.
No. Tomato, this is for me. Thank you. Thank you very much, Eudal. Let's continue with Telemedi. Rafael Rodriguez is his business development director, and he will share Telemedi approach on digital healthcare, touch of the topic of the new patient journey in the telemedicine, to note the most important aspect of a medical service, the human factor, right? So, Rafael, this is for you. And the countdown. Don't you? Okay. So, the floor is yours.
Hello. Good morning, everyone. Thank you very much for this opportunity. It's going to take me only a few seconds, even though it's not yet running, which is good. Okay. Today, telemedicine is a global company. We have been in the market since 2014, offering our telemedicine solutions, e-health solutions. But today here is all about patients. It's about customer journey. It's about building trust. And in that sense, we have been working quite a lot to develop a complete new customer journey, to build trust for patients, and of course, to think about patient satisfaction. Please, let me share with you how we see this environment, how we are redefining access to telemedicine, and how we think we should evolve in order to make telemedicine accessible to the vast majority of population. Please enjoy the show and enjoy the video.
Telemedicine has grown considerably in recent years. There are different approaches, channels, and technologies involved in this new way of consultation. However, the main principle must remain the same, giving patients the medical health solution they need. Most companies in the digital healthcare environment are using a technology-focused approach, where the main and most important aspect of their solution is the technology. In fact, the most important aspect of a medical service is the patient, their needs, and the solution we can bring to their medical conditions, pathologies, mental health, and well-being. The patient-focused approach in telemedicine and e-health aims to bring back the most important aspect of a medical service, the humane factor. This novel trend is being triggered by the same technological evolution that has brought telemedicine and e-health to our daily lives. However, its importance increases exponentially. Hence, the patient must feel closer to their health service. The personalization in telemedicine and e-health is an approach where the one-size-fits-all claim is abolished. It is a combination of different aspects related to the patient's care. The new personalization process is a multifaceted approach in which there are at least 6 steps to take into account. Telemedicine is a challenge even when all resources are available. The main reason for this is the difficult assessment healthcare professionals need to perform through digital channels and to be able to tackle all patients' needs. A proper personalized healthcare is one where the doctor will give the patient the possibility to express concern and attention, empower patients to be part of the decision-making process, create a long-lasting relationship with the patient, and reach out to the patient's feelings and concerns. Patients will always have a reason for their consultations. This reason might not be obvious in some cases, but any healthcare professional should have the ability to find the real reason for the consultation and guide the patient towards a journey to find a definitive solution for its necessities. The new patient journey is a process focused on 4 steps: patient health, condition, disease, doctor's guidance and coaching, concerted decision-making, and final recommendations. Let's enhance the patient's journey throughout telemedicine and e-health by boosting together the new patient-focused approach in the digital healthcare revolution.
Well, thank you very much, Rafael and Telemedi. The next 4 minutes of glory goes to Cedric Georgi. Cedric is a Deputy Director of Caduceo. What's Caduceo? It's a startup expert in data science applied to the healthcare sector. Hello. He will present KioSmart, a no-code healthcare data science platform, empowering healthcare players to unlock the potential of their data. So, Cedric, good morning. This is for you.
Thank you.
And this is your 4 minutes.
All right. Hi, everyone. Really pleased to be here, traveling from Toulouse, so kind of neighbor from here. We all know that healthcare organizations are facing complete new challenges, increasing challenging and complexity of treatments, complexity of new pathologies, new data, quality requirements, financial performance, difficulty in keeping or recruiting professionals. So they need to have more data. And we believe data science can help and is already helping. Massive data is generated, it's being stored in warehouse, data lakes, and professionals are already using data science for some research projects and for some of them in organizational issues. But there's a but. Data science for healthcare is highly specific on one hand, meaning that you need to understand the health data, you need to understand what are the security requirements, for example, and data science is expensive for health industry. So we're bringing to the market KioSmart. KioSmart is a no-code healthcare data science platform that's for the startup world. For the healthcare world, we're just explaining that we help them in a better use of their own data. And to do so, a very simple process. So the platform will help professionals import the data, either with different files or with connectors to the EHR, FHIR, for example, as a interoperability standard, and then we'll do the preparation. 80% of the data science job is always on the preparation of the data. Then the professional, the user, the only thing he has to do is to precise what we call needs, so questions. What does he want to know? What is the challenge he has in a service, or what does he want to showcase to the team, for example? And the platform will suggest, manually or automatically, new data tasks from very simple ones to predictive models. And then the user will be able to share and use results on the side. A few examples to make sure it gives you in the right direction. It's from very simple use case, like I want to share key indicators with my team. As a head of service in many countries, you don't have such tools. You don't have such access to data. It's always at the top of the institution. So management has data, but healthcare professionals, they don't have it. So we want to empower them with simple use case like interactive dashboard, but also like building predictive models for new patients arriving at the local level, not at a big national level. This is something we did for COVID-19 with 12 institutions in France. And also another example is I want to understand pathways because they are being really complex, so doing clusterization and pathway modelization. A few of the key building blocks of the platform. What is key here, I talked about a few, but explainability in AI. We have a research team working on that, making sure that every time there's a prediction, there's an explanation that comes to that, and also what we call the interpretability model. So you explain what are the variables that play the role in the model, and then a few of other things. But I want to finish on sharing a few words about Caduceo, the company that brought this to the market. So it's 16, you need to read here, 16 publications. We have a history of products for healthcare institutions working on the national database in France. But with this new tool, KioSmart, we're expanding. We are not limited to France. And that's why we're here, and that's why we're looking for research partnerships, and not only for Horizon Europe, but also healthcare organizations to collaborate and making sure our product will be global from day one. Thank you very much.
Merci beaucoup. Okay, Coco Health transforms the patient journey with digital care solutions that improves care experience, revenue, and adherence. His CEO, Robert Parada, for sure is almost ready to come to the stage with me. Take your mic. Can I put your badge off, please? Yes. Thank you. So the floor is yours. This is also for you, and this is your countdown, okay? Thank you.
Good morning, everyone. This is Coco. We transform the way how clinics interact with patients, automating all the patient journey in order to improve experience, adherence, and revenue for our clinics. Basically, we automate call centers and we use artificial intelligence such as chatbots, self-booking, and telemedicine software. We operate today in more than 100 clinics, and moreover, we are winners of EBPA Awards of AstraZeneca. This is our passion, the triple aim triangle. All of our technology is focused on creating a healthier population, improve the experience of care, and reduce the per capita cost. But this is better to understand with a history. This is Diego. Say hi, Diego. Diego needs a medical appointment, but every time I talk to him, he's trying to call the clinic and no one picks up the phone. He has to call again and again, and when he gets the appointment is for the next month, and he needs this now. So this is very hard to get, and he forgets the appointment, so he needs to start again. Today, we are in a world where you can open your phone, order an Uber, and you have it in 5 minutes. But for a medical appointment, you have to wait a month. And that's what we are changing. And this is the installed capacity of a clinic. They try to use it all, but they only can use 70% of the installed capacity. A lot of patients are trying to access to the system, but doctors do not see 6 out of 20 patients. This means that clinics are losing around 3 months per year. And in today's world, we cannot afford to waste resources when we have the technology to do so. I am Robert Parada, co-founder of Coco Technologies. I am very proud to present Coco, our big brain, an artificial intelligence system that has a booking software, a self-booking that connects with appointment rescue, with chatbot, with prevention programs, with teleattention, and all the features that a clinic needs to maximize the user experience. For example, if Diego needs to book an appointment, they only goes online, they don't have to call, and he can book an appointment with an amazing user experience, choosing the type of appointment, and the system offers the nearest appointment, and basically when we fill easily the information, the system gives a QR code for easy use of the clinic. And this is our outbound case study when clinics can upload the database in Excel to the cloud, and our bots are going to contact the patient through WhatsApp and phone in order to book the appointments and to make prevention calls. For example, we can contact thousands of patients in only seconds, and this is very used today for prevention programs such as diabetes. And if Diego forgets his appointment, the bot is going to call him or write him in order that they do not forget the appointment.
Hola Diego. Recuerda que tienes una cita hoy para prevención de diabetes. Será a las 3 de la tarde, y debes ingresar al link que te acabo de enviar a tu celular. Tu médico te está esperando.
After that, the bot writes to the phone and gives him the link, and he opens that link and put his ID, give the permission in order to use the microphone and camera, and the doctor is waiting for him by the other side of the phone. After this call, Diego can finish the call, and also he can put some stars to the doctor and to the clinic in order that we can have that scores and feedback from the client. The benefit for patients is a better health clinic in his pocket, and for clinics, they are going to increase the volume of patient and reduce cost. If we start Coco in 10 clinics, If we install Coco in 10 clinics, it is like if we create 3 more. Because when we add up the capacity that we were losing, it is equal to the capacity of 3 new hospitals. So with technology, we are making more efficient what we already have. We are today in more than 100 medical centers in 4 countries. We process more than 4,100 appointments per month. We grow 400% per year, and our retention is over 95%. We are over our break-even. We have won national and international prizes, and we operate now in 4 countries. Thank you so much for your attention, and this is my LinkedIn profile if you want to write me. Thank you.
Thank you very much, Robert. Thank you. Let's continue with Tech Care. Jonay Armendariz is his product owner, and Tech Care is a solution to improve hospitals' organizational processes efficiency. So, Jonay, I think is everything almost ready. Thank you very much.
Thank you, Helena.
And this is your stage and your countdown.
Hello.
Thank you.
Hello, as you said, Tech Care is a solution to help organizations to improve their cost efficiency while improving the patient experience. This might be, let's say, contradictory, but it's not at all. How many of you were in the last month, in the emergency room? Did you notice how crowded was it? Imagine that we could get rid of this 10% of the people that is waiting in the emergency room without the need to be in there. That will cost to your hospital around 1 million euros a year. Sorry, 1 million euros a year. Once again, do you match the last appointment that you have with your doctor, or you miss it? Did you forget to send them anyhow a message or somehow to notice that you are not going to be there? Well, the no-show rate is around 40% in current hospitals. And that costs about 6 million euros a year for the mid-sized hospital. Let's try and imagine the last thought. Imagine that after surgery, you have been in the hospital for 4 days, and you can arrive to the hospital 1 hour later. Do you think this is a good thing? That would cost around 700,000 euros a year for a mid-sized hospital to occupy beds that should be ready for new patients to be there. Okay. So let's frame the situation. Okay. I'm presenting here Tech Care, that is a solution, a web and mobile solution to increase the productivity of the hospitals and reduce costs, as I said. We have 6 modules and 6 solutions that I will show you now that are GetOn. It's a solution to provide the hospitals the possibility of arrange their agendas and manage all the calculation. Sorry again. And well, the second solution is FindPath. It's a kind of sub-navigation for patients that you can go from point A to point B in the hospital without missing any point there. The third solution that we have is Discharge Track. It's a solution to help the discharge of the hospitals. We noticed that one of the main pain points of the hospitals is how often a patient should be there more than needed, and I think we think that this Discharge Track can help hospitals to improve the efficiency. Portugal is a solution to improve the communication among the different teams in the hospital in order to provide solutions to queue the task that a porter should do in the hospital. Basic Journey is a solution to track medical devices and patients in the emergency room that could help these patients to get the best attention possible. Matriarch is a solution to allow patients to pre-triage themselves in order to know if that's, or how long they are going to stay in the ER, and provide solution for them in order not to go there if it's not possible. Notice that we have a 10% of people in the emergency rooms that should not be there. So let's think about that, and why not take a lead to the change of the hospital. Thanks for attention. Bye-bye.
Thank you very much, Funai. We can leave it there. Well, our last 4 minutes of glory goes to Panel Health. Ana Vadillo is the Chief Product Officer of Panel Health, a company aiming to activate patients' voice. She will present the SIAS product that gathers patient input to improve hospital service. On the other hand, Beñat Galdós is the Chief Technology Officer of Panel Health too, and he will present the key technical features of the product. So, Beñat, Ana, thank you very much. Good morning.
Well, hello everyone, and thank you very much for coming to our presentation of Panel Health. What does Panel Health do? Well, we solve a problem that probably every one of us here has suffered at some point in our life when dealing with medical services, which is the lack of communication and understanding between patients and health service providers. Patients enter the health service with a lot of questions. They don't understand what's going on. And health providers spend a lot of human resources and technology trying to guide them and informing them in this new patient journey. However, patients do feel like numbers, and they are treated like numbers because they are moved from one place to another. So in this broken scenario is where Panel Health plays a key role.
So, how do we solve this issue? We create a systematic patient experience measuring platform. What does it mean? It is consisting on two parts, some sort of chatbots and a dashboard, which aggregates those chatbots results. I will explain that in a while. So, essentially, those chatbots are intelligent chatbots which adapt to the conversation flow with the interviewee, in this case, the patients. So, what do? Essentially, they understand what the patient is saying, and it adapts the words, it adapts the phrases, the questions, etc., to that specific patient. So, how does it work? It breaks up to 3 parts. The first one is a management panel, which essentially contains the patient's data and where healthcare professionals can choose those patients. Those patients are sent an SMS, which contains a link to the chatbot. And in this specific chatbot, they do respond the questions which are considered in this chatbot. And after that, what we do is aggregate those results of those patients, anonymize, pseudonymize them, and break them to a specific dashboard, which is powered with machine learning and has some flavors of natural language processing, which, for example, what it does is to extract the main topics those patients are talking about.
The benefits for patients is to give their honest feedback anywhere and at any time. There is no constraints for them to use the chatbot and to give that information to the health providers. And for these last ones, the benefit is that they can either send 20 questions or 2,000 questions. The system is scalable and requires the same effort. All that information that is gathered is systematically measured and provides trends and insights that the health providers can identify where that patient journey is broken and act on those problems. And last but not least, the Panel Health doesn't need to be integrated in the system. It can be used tomorrow in any hospital and use the service and the benefits of Panel Health.
Yeah, so in order to mention some use cases, for example, we are working right now with the Hospital 12 de Octubre, where we are implementing 2 pathways, lung cancer and breast cancer, and we are working towards doing more pathways with them. And lastly but not least, this is us, Ana, myself, Beñat, and Asier, who is the CEO, but he's here because he's leading another implementation in Madrid right now. So that's it. We are open to any questions. Thank you.
Thank you.
Thank you very much. To all of you, all these first 7 companies that had the opportunity to present their project to us. Remember, to all of you that are here physically, and of course, all of that you are following us online, you can contact all of them just by using the app, VHH app. I'm sure that you already have it, so you just have to use it for this networking. Well, now it's time to get dressed up because we are going to start with the VHH Awards. Let me introduce Oscar García Esquirol. Good morning, Oscar.
Good morning, Elena.
Chief Medical Officer at Barcelona Health Hub. I'm a little bit nervous.
Why?
4 awards, 4 different categories.
This is the best moment of the morning. It's a happy
Absolutely,
moment.
absolutely.
I'm so delighted.
Having all of them right here,
Yeah.
it's fantastic.
Perfect.
And another opportunity to celebrate.
Of course.
So, Oscar, as you explain us, we are going to recognize the best 4 companies in
Yeah.
4 categories,
Yeah.
right? What are these categories?
We built 4 categories this year. The best innovative startup.
Mhm.
This one is designed for consolidated startups that support patients and their families.
Mhm.
The best innovative hospital. The
Mhm.
best innovative corporate. Today we have one of our main sponsors there. And the best innovative initiative. So, ready?
And everything just for implementing and offering digital tools to improve the journey and experience of the patients and, of course, their families. Well,
That's the point.
I'm so excited to start mentioning the first category, which is Best Innovative Startup, and the 4 companies.
There we have Curity, Medify, SharePlay, and Lactab.
And the first award that we have just right here with you, Oscar, goes
And
to...
the winner is
Who will be?
Lactab.
Lactab! Congratulations!
Yeah.
You can come here to the stage if you want.
2,480 votes.
Wow.
Impressive. Congratulations.
Thank you
In
very
the
much.
middle, just in the middle.
Well, first award of the morning. How do you feel?
Excited and humbled to be part of this event and to be recognized as a leading health startup, specifically in the breastfeeding space and the women health space, which is a hard one. We're very happy and excited, and thank you from the rest of the team.
Thank you. Thank you very much. Maybe we'll take a family photo with you.
Yeah. Come here.
If you don't mind staying
Congratulations.
close to here
Yeah.
for
I'll keep
an
it.
ending photo. But for us, time to continue with the next category.
Yeah, with
which
the
is,
best innovative hospital.
Who do we have in this category?
Sant Joan de Déu de Barcelona, Germans Trias i Pujol, Hospital Clínico San Carlos y el Hospital Virtual Valdecilla.
Oh, this is amazing. Amazing. Who will win
Yeah,
in
it
this
was-
category of Best Innovative Hospital?
And
Let's
the
see,
winner
let's
is,
see, let's see.
the award goes to Sant Joan de Déu de Barcelona.
Big applause to San
Congratulations.
Juan. Congratulations.
That's for you.
Thank you. Congratulations.
Thank you very much. Congratulations also to all the other participants and great event that you organized.
A lot of votations.
Yeah, and notice that 7,027 votes.
Wow.
Impressive.
So,
Thanks. Thanks to all these votes, the people that voted, and I'm in representation of all the institutions, so thank you.
Okay, so
You're welcome.
let's take a photo. Just wait here.
Thank you.
Thank you. You can stay close to the stage, please. And let's continue
Let's
with
go
the
ahead,
third category, which is Best Innovative Corporate. with Sham,
Yeah. Movistar Salud
AXA,
and Suboda.
and the winner in this category for the Best Innovative Corporate is...
Movistar Salud.
Movistar Salud. Congratulations. Yes. Thank you very much. This is for you.
That's for you.
Congratulations to all of you. Thank you. A pleasure having you here. Anything that you'd like to say to our audience?
Well, we are very happy to have this award, and Telefónica and all, especially all the Movistar Salud team and Teladoc, are very proud to be able to help people.
Yeah, we are happy to be here and to have the opportunity and to be recognized as a company that innovates in health. So proud to work with the people trying to close the health to the people.
Of course,
Thank you very
of
much.
course. Thank you. Let's take a final family photo. Thank you.
Thank you.
A big applause to Movistar Salud.
And the last one.
For us, yes, we have to carry on
Yeah.
to the last or the fourth category, Best Innovative Initiative.
Initiative, yeah.
And we also have 4 different initiatives.
Yeah. We
First
have
of all,
Investigación en Inteligencia Artificial para la Leucemia, Peter Moss.
uh-huh.
Calita, just beside this pavilion.
Mhm.
Palia Clinic and Foundation Love Vixer.
Well, good luck to all of you, but unfortunately, we
Only one can win. Yeah?
Yes.
That's a pity.
And the winner is... who will be?
Palia Clinic.
Fundación Palia Clinic. Congratulations.
Congratulations. A very, very nice initiative.
Yeah.
Yeah.
Please take this.
That's for you.
This is for you.
Congratulations.
And well, thank you. Thank you very much. And again, congratulations.
Thank you very much. Well, we are very proud and illusioned to receive this award. This award is especially for our volunteers and more especially for the dying people. Innovation is science and technology, but humanity is also innovation, and that's what need especially people who are dying. Thank you very much.
Thank you.
Very nice. Thank you very much.
And can I ask, please, all the 4 category winners?
Yeah, we
can
have to
just-
take a photograph all together.
Yes, please.
Come up to the stage
Movistar, all of you.
with your awards.
Well, time to show to our photographer your awards. You are the winners.
like a football team.
Of course, of course. So 1, 2, 3.
Cheers.
Okay, thank you. Thank you very much.
Congratulations. Congratulations.
I would like to ask not only the winners, but all the companies that was here in the awards, can you come here to the stage with us for a big photo of all the family? Oscar, please. Can you come here with me too? All of you. Sham, Movistar Salud, AXA, Suboda, Investigación en Inteligencia Artificial, Cálida, Fundación Palia Clinic, Fundación Love Air. All of you, if you don't mind staying here with us on the stage. Sant Joan de Déu, again, please. Germans Trias i Pujol, Hospital Clínico San Carlos, and Hospital Virtual
Come
Valdecilla.
ahead.
All of you, all of you.
Yeah.
A big family photo. And of course, Medify, Curity, SharePlay, Lactap. all of you, winners, and not winners, but participants. Thank you.
Perfecto.
I think. So 1, 2, 3. Okay, just a smile. Thank you very much
Perfect.
for
Thank
your
you very much.
participation. It was an honor. Okay, well, now it's time for all of us to take a rest. It will be just 30 minutes break. So time for you to grab a coffee, to stretch your legs, and of course, to enjoy networking by using the app. You can see the QR code on your screens and here behind me, just for you if you need to use it. So take your time and see you in 30 minutes. See you later. Well, welcome back to all of you. Have you rested and eaten anything? And of course, I suppose you've been doing networking as well. Okay, good for all of you. Okay, let's now welcome Luis and Marja, our CEO and Chief Communications and Community Officer here at Barcelona Health Hub. They will tell us a little bit more about, Barcelona Health Hub. So, Luis, Marja, welcome on the stage. And whenever you want, the floor is yours.
Thank you very much.
Thank you.
Thank you very much. Well, it's a great pleasure, again, to be here. And for all those who don't know Barcelona Health Hub, or even for all those who know in Barcelona Health Hub wants to be updated, Marja and myself will give you this update. So if this works, I don't know what's the matter, but, well, first starting telling you that Barcelona Health Hub, as you know, the mission, well, it's a non-profit association. The mission is to promote innovation in digital health and its transfer to the sector, linking startups with corporates, with health organizations, and with investors. Currently, today, we are generating innovation in health through IT. We are promoting startups and helping them to be validated by the hospital and fostering interactions. So Barcelona Health Hub is the place to be for interact with other actors of the ecosystem. Well, we are based in this impressive place, which is the Art Nouveau side of São Paulo, devised by Luis Domènech i Montaner, and declared World Heritage in 1997 by the UNESCO. It occupies, Barcelona Health Hub occupies 5,000 meters squares, and we are in 3 pavilions, San Manuel, San Leopoldo, and the operations. And we are combining the Art Nouveau with the high technology for the ecosystem. Well, we are located in, an ecosystem, and also we are located in an ecosystem. With the B, the 3 buildings of Barcelona Health Hub, with the F, the foundation of Puigverd, with the U, University of Medicine, with the K, Cálida Foundation, with the H is the Hospital of São Paulo, with the R, Institute of Research, or Research Institute of Medicine. So we are located in this ecosystem, which has a lot of contact with all the actors. What is really doing in Barcelona Health Hub? Well, this tips networking. We say always that we are in the best place to be. We are a strong global communication engine. We are producing a lot of events than BHH Summit, BHH Series, Summit in LATAM, and also eHealth Investment Forum we had celebrated some weeks ago. We're all an important stakeholder in health or in digital health. Currently, today, we are 295, 192 are startups, 36 corporations, 55 health institutions, health organizations, hospitals, etc., and 11 investors. We have reached from the scratch these 295 from 2018, and our expectation, our forecast is to reach 300 in the end of the year. And finally, I have to point out all these digital technologies applied by the startup into the ecosystem. So having said that, I pass the floor to Marja. Please, Marja.
Thank you, Luis. Thank you. I would like to give you all a brief summary of all the events that BHH have organized this year. And we would like to start with this one. It's the Barcelona Health Hub 5G design. It's a 5G lab located actually in the BHH headquarters. It's a project that we organized together with Mobile World Capital, Idoscat, and Grupo MásMóvil. If you're interested, I would encourage you all to go to the BHH website We have a page dedicated to 5G, and you can register yourself, and then we'll contact you. Then, in April 15, it was time for the BHH Summit Iberoamerica. It was actually the first BHH Summit dedicated to a Spanish-speaking market. It was actually a great success. We had an audience of over 30 countries, all connected throughout the world, including Argentina, Chile, Mexico, well, all over the place. It was actually a great success. We had an audience of more than 800 people in total. Then, in June, it was a great moment. We could finally attend a live event again. So we were present at 4 years from now with various of our BHH members. In total, in the 4 days of the conference, there were more than 50 BHH members present. If you're interested, stay tuned, because we'll probably do it next year. Again. Then, only a month ago, just as Luis already told you, we organized the second edition of the eHealth Investment Forum. The eHealth Investment Forum, we organized it together with Collegi de Metges, ESADEBAN, EET Health, and Barcelona Activa. This year's topic was specific about artificial intelligence. Then, just 2 weeks ago, very recently, actually live from this building, the same building, we organized the Investment Readiness Series together with Biocat. This time it was time for the MedTech edition. Then an event that still has to happen. It's in 2 weeks. We are going to be present at the International Hospital Forum. We will obviously represent Barcelona Health Hub, and the idea is to continue advancing in hospital validations. Last but not least, it's the BHH series. The BHH series are monthly webinars about various topics regarding digital health. We already did more than 26 episodes already, and it's all about different topics. It could be virtual reality, DTX, much, much more. If you're interested, please go to the BHH website, because we have all previous episodes available, and you can watch them all. And last but not least, I want to give you a little heads up. The next BHH series is on November 23rd at 11 a.m. CET, and it's about bringing the highest level of healthcare among elderly people through telemedicine. That's about it. I would like to give the floor to Narcis Roura. He is the General Director of Southwest Europe of PepsiCo, and he will tell us a little bit about NetMentora.
Okay. Thank you very much.
Thank you.
Thank you very much, Luis and Marcia. Wow, what a year. Plenty of activities, a lot of events. So, well, good news. Now, time to move to the breakout sessions. For those who are online, in the agenda, you can see the different sessions available. You just have to click on the sessions you'd like to attend, and the sessions know that will start in more or less 5 minutes, just to give you time to get on the road, right? Note that the language that in each session is the same that you can check here on the description on this screen, okay? All the other sessions that you cannot attend, no worries, because we will be available after the event and for a month on the BHH YouTube channel. For those who are here in a live event, you can join one of the rooms for the following sessions. So, Charm will be here in this room. Multiplica and Alexion will be on this floor, just outside the auditorium on your left. And Lookup and NetMentora, as Narcis will explain, will be upstairs. Then TKPCP in Barcelona Health Hub building. You just have to go straight ahead and go outside to your left, right? So remember, I explained before, all the sessions will be recorded. So right now you have to choose one of these 6 sessions, but then you will be able to enjoy all the other sessions from now on until all next month on the BHH YouTube channel. So thank you, and let's start with the breakout sessions.
Hi. I'm Narcis Roura, General Manager of PepsiCo Southwest Europe. And I'm here to talk to you about NetMentora, the biggest network of collective intelligence and cross-innovation in Europe. A network that connects startups with local companies and multinationals. A network that mentors startups and generates value added to senior professionals and established companies. I can describe my experience in NetMentora as one of the most rewarding development programs I have been in my career. First, helped me to get out of the golden cage of my job. Also shows me different business models in different sectors. Allows me to interact not only with entrepreneurs with an unbelievable and inspiring attitude, but also with top managers from other companies. And it's a way to give back part of what I have learned during my career. That is the reason why I invited all my team to join NetMentora. And that's also the reason why I encourage you to do the same. So, see you later.
Yeah? Es que ahora no hace falta. No. No, lo haremos después. Welcome back. I hope you enjoyed and your other sessions were interesting. Remember that all the other sessions that you didn't attend will be available from today after this event and during next month through BHH YouTube channel. So just do not hesitate to enjoy all the other sessions during this month. Okay, now we move on a second show and tell sessions with more presentations from startups. We will have 6 companies right now. So remember your famous 4 minutes demos of your technological solutions. You will have a countdown just in front of you. And let's start. Let's start with the first company, which is Sequentia. Walter Sanseverino is a CEO and co-founder of Sequentia Biotech. He will be presenting MIC. What is MIC? A microbiome analysis platform for personalized healthcare. So, Walter, whenever you want, the floor is yours, and this is also yours.
Thank you very much, Helena.
You too.
Hello to all of you. I am Walter. And today, in the next 4 minutes, I'll talk about MIC, the first translational microbiome platform. Before to talk about MIC, let me introduce what is the microbiome. The microbiome is the unique set of microorganisms that live in and on us. And this set is very, very important for health because when we have an imbalance of this microorganism that is called dysbiosis, we can have several diseases like chronic disease, neurological disease, gastrointestinal disease. So there is a very big opportunity for patients because if we are able to implement this type of analysis inside their journey or inside their analysis, we can benefit a lot about it. But there is a problem. There is a very big problem in microbiome data analysis because it's very complex, it's very expensive, and you need a very huge informatic infrastructure. And for this reason, we created MIC. MIC is the first digital platform that helps doctors to integrate microbiome data analysis inside their practice. We created a cloud-based solution, and thanks to our innovation, thanks to our proprietary algorithm, proprietary database, we are able to create a workflow that directly gives to the doctors an evidence-based report with actionable results. In this moment, we are selling MIC in 5 different countries, and our clients are using MIC in different healthcare verticals, in gastrointestinal disease with the gut microbiome, in reproductive health and infertility with vaginal microbiome, or for example, in eyes microbiome with, for eyes infectious disease. Why our clients use MIC? Because they use MIC to detect and assess dysbiosis, that is the imbalance, to manage the microbiome during the time where their patients perform a specific treatment, and then they use our platform for a decision-making support system to enjoy about this type of analysis. We, in the last year, innovate a lot the workflow of microbiome data analysis. We created our own workflow, and this is the comparison between LifeNow and what we are providing with MIC. You need a very expensive infrastructure. Our system is cloud-based, real-time, automated, without no upfront cost. You need an expert bioinformatician to code the analysis and an expert statistician to interpret this analysis. Our workflow with artificial intelligence and machine learning is automated. But finally, maybe most important, you do not need to interpret this type of data because our system gives you an actionable evidence-based report that the doctor can directly use, that can directly integrate inside their analysis and their workflow. Thanks to MIC, we have a cost saving up of 75%. We increased the diagnostic yield, obviously, and then we increased the service offering to the patients and scale up clinical services. Our clients are private clinics, doctors, nutritionists, and hospitals. And in case you have microbiome data, you have only one choice, that is MIC. Thank you very much.
Thank you, Walter. It was a pleasure. And let's continue with Dr. Sven Molfinger. Sven is the co-founder of 1,000 Colibris. 1,000 Colibris is a company focusing on the health and well-being of women during motherhood. So what he will present today is Dana. Dana is a software as a medical device solution for the early detection, diagnosis, and monitoring of mental health pathologies. So, Sven,
thank you very much.
Be very welcome here. Thank you.
This is Maria. Maria can be you, your wife, your daughter and sister. As a woman, Maria should be happy to become a mother. But is she really? And does it matter? We started to map all appointments during the matrescence journey. Matrescence is the massive mental, physical and social transformation of a woman when she's becoming a mother and lasts around 4 years. Normally there are around 60 appointments with 7 healthcare professionals. Now the investigation showed that there are less visits than thought. And many of the women never have a contact with a mental health specialist. And this leads to the hard truth. There is a 90% possibility for a woman to experience a mood disorder during motherhood and up to 25% possibility to suffer severe maternal health disorder. But we will never know who is affected. 75% go underdiagnosed and we won't be able to help. Mood disorders and mental health pathology during motherhood have a direct effect on the health and well-being of the mother and our capacity to take care of the child, with potential long-term negative effect both for her and for the baby. That's why we created Dana. Dana is a digital assistant to improve the well-being and the mental health of the mother during motherhood. On one side, Dana is a digital assistant for the individual to empower and inform her with specific features to help her to release her pains and her needs. On the other, a software as a medical device and a digital therapeutic solution for the healthcare system. Our IP is the Motherhood Vitality Index that is following the mental health and well-being of the woman during the 4 years journey that has been developed with top universities. We built a scalable architecture for the early detection, diagnosis, and monitoring of mental health pathologies during motherhood that can be scalable to other countries from start. We launched our first MVP in March 2021, created 30 psycho-educational programs and tested them with users with more than a 70% efficacy. We launched a second MVP now in September to continue to work with the users and then get more information to build a first layer of artificial intelligence. Next year, we will start to build the software as a medical device interface and continue the pilots and clinical studies. Objective 23, achieve the digital therapeutics and medical device certification. We're working with a hybrid business model, launching an app to gather user data that we will distribute as a B2B2C with healthcare professional with a revenue share model, and then move towards a software as a medical device and digital therapeutic solution in the future. Veronica and myself launched Digital Venture in the past and had the opportunity to lead international companies in different countries. We are blessed to be backed by an intergenerational team of experts in big data, analytics, AI, chatbot, perinatal psychology, mental health, and mobile development. Let us fight mood disorders and mental health pathology during motherhood. Together, we can cut this number by half in 4 years and offer to the healthcare sector a diagnosis and monitoring tool for the patients. The market is huge, and together we can help the life of millions of women, their babies, and their families. Thank you.
Thank you, Sven, for your presentation. Now, next 4 minutes of glory goes to Universal Doctor, the global digital health company. Jordi Serrano, his CEO, will present UHDA Health. Is that correct, Jordi? UHDA Health is a Universal Doctor spin-off with the mission of uniting and democratizing digital health. Right, Jordi? Thank you. Welcome to the stage. This is your mic, and your 4 minutes start right now.
Thank you. It was a kind of surprise. I thought I would speak later, but thank you very much. And you pointed that well. We are a spin-off of Universal Doctor. No? I was waiting to listen to UDA. What is UDA? Universal Health Digital Access. okay? We want to have a company that really delivers, no matter the budget that you have, the digital health solutions. This is very important. What do we offer, or where we come from? We come from a team, amazing team of Universal Doctor. We have Fernando Vaquero, CTO, Janine Lemaire, working with these people during 10 years in many international with many international organizations, countries, hospitals. We have here Ricky, an amazing guy that knows every innovative project. We have Elsa here that is wonderful in all this biotech world. We have Patricia here. He spoke in the morning, Chief Patient Officer of Universal Doctor, and now UDA. The team is super important. That's why I'm wasting a lot of time, no, in that sense. Now we have all this background and we're using it to launch new initiatives. We have all these own tools, like the translator. We have all these tools done by international organizations, by governments. Now we launch the app of citizens of Andorra, no? The app, the equivalent of other apps here in Spain. We have the citizen app of the Andorran citizens, which will allow us to do things that before were impossible with engagement of patients in that sense. Now UDA offers a package that is clear, doing implementation of evidence-based digital health solutions, or own solutions, or other solutions. We have here later other people's platforms that we can really make packages and implement it as a monitoring healthcare system, as a studies healthcare system, or a virtual visits also, of course. But we have all these two platforms, monitoring and studies, that have been already implemented in different places. And moreover, in what we are super excited is to offer these services. We are already offering that in many different places, at least 5-10 hospitals and some countries. We're offering them statisticians, epidemiologists, researchers, data scientists, starting to do that. And this is the point. And what else? Patients from the beginning. This is super important, not later, from the beginning, is this combination of that packages, okay, the software plus the services that make us quite happy, and we are open to collaborate with any platform in that sense. The technologies, remote patient monitoring, as you will see, it's already implemented in some cities. The studies, we started before during the pandemic with a platform called Epidemics. Some of you know, in a solidarity way. It's being implemented in many places, and now we are just having a lot of requests from these places to even professionalize more and more, to collect data, to compare the data with other collection tools, and to basically do studies that really, for example, for long COVID, no, really focus in patients, most important way, no? That platform already implemented, for example, in the city of Castelldefels. We will do the Healthy City Excellence. That platform already implemented in X, Catalonia Central, in Andorra, in other places. Now will be used by international organizations also. And basically, we work together, for example, here with the German company, to customize this. That's Christian Blind Mission, that's Handicap International at a very important level. Basically, working together with the combination of other Legos, implementing them, and basically co-creation the process. You are invited to do that with us, and work with us to implement your own solution if you want, and give the solution to everywhere and everyone that needs it, no matter the price, fair price for you and for them. Thank you very much. Thank you.
Thank you. Thank you very much, Jordi. And from UDA to Lighthouse, we have here with us Esteva Vilella, his CEO and co-founder. And Esteva, I think you will be presenting, it's a We Share Care, right? The platform for continuous care. So you can start whenever you want. Just a second. It's okay.
Yeah, it's okay.
And just pressing here. All right. Yeah, you can go ahead. Thank you.
Well, thank you again, GHH and Christian team for this opportunity. It's not working. Working?
Yeah, just a second, please, because we will change your mic. Event on live, physically here, so. But
no problem.
Now go ahead. We can start again in 4 minutes, okay?
Thank you again, BHH and Christian's team for the opportunity for presenting our initiative, We Share Care, that we launched in Massachusetts, in Boston. Well, what is We Share Care? We Share Care is a cloud-based business platform when monitoring and continuous care. We use our strong network of the partners, and we use artificial intelligence technology for this objective. Our first statement is We Share Care connects the user's needs with certified caregivers at any time, everywhere. This is an holistic vision for We Share Care platform. It's a strong partnership with Connect with the APIs, and then we have a conversational app for the customer or the users, and we have a franchise business model when we have a franchise app and a control app for monitoring all the business model and the functionality for our partnership network. Okay, well, this is a look and feel of our user app, but you can show the avatar control system, dialogues, and AI technology that we put in order to obtain advantage and functionality for monitoring and continuous care. Well, proof of values, user proof of values, and caregiver proof of values. We connect several stakeholders in the ecosystem for getting advantage or functionality for monitoring in continuous way. Well, our main target, we are working with the nursing homes, with hospitals and insurance and pharma and biotech laboratories. Well, we choose 3 case studies for Fonsanta Soler, which is a real case in nursing home, but we get a tool to assist in digitalization of resident monitoring tracking, optimization of caregiver tasks, and immediate updating of resident records. And we collaborate with Eurecat for a Never Home Alone. It's a next generation EU funds for obtain a good design of social intelligence assistive robot, because we have a lot of interfaces for connecting the users and the caregivers. And another is a huge collaboration consortium with San Joan de Déu, Tufts University from Boston, Affectiva, and Cima Robots for validate the use of their social robots and a social connector at home between the patient, family members, and the healthcare community. We are very, very proud about our collaborators. We have over 16 companies that connect their functionality with our platform, then extend our functionality in other in more country, increase the commercial activity, and increase the investment. This is our nowadays franchise network in the USA, Panama, Spain, France, Switzerland, and India, and we are working for 4 countries more. This is a strong team of advisors from Cambridge, and we are a rocket star for this initiative in which very much, and we are open to collaborate.
Thank you, Esteban. Thank you very much. Let's continue with Fosanis. Pablo Prieto is the Chief Revenue Officer at Fosaris, makers of the Oncology Digital Therapeutic Solution, which is named MICA. He will present MICA and its integration in a care setting as complex as cancer with Germany's DIGA model. So, Pablo, welcome on stage.
Thank you very much.
Here you have your presentation. The time is yours.
Thank you. Thanks for the invitation to present MICA. My name is Pablo Prieto, as was said. Before we start, I'm going to tell you a little bit of a story. I think it's a story that pretty much everybody can relate in this audience. Either you've lived this on first person or through friends or relatives. It's a cancer of story. In this case, Claudia is not an artificial person. It's our head of marketing based in Berlin. When she was 38, about 12 years ago, she was diagnosed with leukemia. You can understand, as I said, the moment of diagnosis of cancer at the age of 38, then undergoing a lot of chemotherapy cycles, then bone marrow transplantation. All those difficult treatment decisions, the lack of energy, the difficulty in communicating this to family and friends, and so on. But now she's back to work, and she's still facing a lot of the difficulties in coming back to work with full strength. So it took not only the best drug treatment to overcome cancer, but also a ton of resilience, and a lot of empowerment to make those decisions, hard decisions sometimes. So that's what Mika is all about. Claudia's passion, as you can see on this picture, it speaks for itself. I mean, it is our passion to try to get cancer patients to that level of empowerment. So really, what is Mika? What is Mika? So Mika is a digital therapeutic. It's not a wellness app. It's unique to each person. We tailor the experience using two elements. The first one is monitoring. So we tailor, we measure symptoms and the level of stress or distress that each patient is suffering at a given time. And then we use that with the cancer type, the stage of cancer that you're at, where you're in diagnosis and treatment and so on, all the way to providing courses, journeys that are using psycho-oncology as the basic support. And as I said, this is a digital therapeutic, so that means that we're a medical device. The DIGA regulation means that this is interoperable. There's a ton of privacy issues, and there is clinical efficacy. We have 5 clinical studies. The results from the pilot study are shown here. There is a decrease in fatigue and in distress that is very significant, and we're proving that in other studies. So we've hit a number of milestones that we consider very important. We're the first cancer DIGA in Germany. DIGA, for those of you who don't know, is a scheme where social security systems in Germany fully paid for the treatment with Mika. It's approved for all cancer indications, not just a single one. And this is because we're grounded in psycho-oncology. We have pharmaceutical partners, patient care partners, and hospital partners. So our business model is very much grounded on partnerships. We have already tremendous growth and revenue. Pretty good engagement, and the team is actually a team of 30 people that are very passionate, as I said before. What's ahead of us? So we're going to be expanding into other countries. So I'm here looking for partners and investors who want to be part of this super exciting journey to empower patients and bring them to a whole different level. Based on our pricing and patient populations, this is a 5 billion market of digital therapeutics in oncology in the EU5 alone. If you consider partnerships, engagement with pharma partnerships has been tagged at 2 billion globally. So there are very big markets that we're trying to tackle. I think we're at the forefront, being a DIGA, with all the regulatory hurdles being cleared, and now it's about growing. We have a very strong culture of people. We focus on people. I think this is proven by Claudia, but many other people. We have oncological nurses, we have psycho-oncologists in our team, and we're willing to grow this internationally with exactly the same philosophy, working with patient associations and co-developing the solution together. And last but not least, our business model is one where evidence and access is key. So we're going to keep on doing that. Thanks a lot. My contact details are in the platform.
Thank you. Thank you very much, Pablo. And the last one regarding this second breakout session is Xavier Leart. Xavier is the chief of Edrix Healthcare, a company focused on enhancing human and technology innovation in the healthcare sector. He will introduce a collaboration model between pharma and technology companies and hospitals and public administrations. So, Xavier, welcome. This is your 4 minutes.
Thanks very much.
Thank you.
Yeah. Does it work?
Yeah, it is.
Right. Well, hello, everyone. My name is Xavier Leart, and I'm the project director of Edrix Healthcare, our company. Since we only have 4 minutes, I'm not going to use any slides. I just want to focus on explaining how we can help your organizations. We don't have a product we sell, but we offer solutions basically to hospitals based on value for patients and for professionals. Just to imagine how we work. Edrix Healthcare at the moment is working in Europe, but also in Central America, and next year we'll start working in South America. But what we do is, I invite you to imagine a triangle, and in one vertex there's healthcare professionals, patients, hospitals, the healthcare administrations and medical societies. On the other corner of the triangle, we can put great startups, companies with solutions that need to be implemented in hospitals. And in a third vertex, we can put the pharma and the medical devices industry. We are in the middle of all these companies, and we facilitate the implementation of projects, basically. Just to give an example, a year ago we were in a pharmacy service in the south of Spain, talking with their chief of the pharmacy service, and he was talking about the difficulties they had with all the pandemic situation we've got at the moment to improve the patient flow, to increase security in the hospital, to avoid many people being together. At the moment, we are developing a project based on facial recognition together with a company that till last year only worked with banks. At the moment, they are also working with hospitals, and this is a great solution that all our team together with the team of the hospital developed. Another example, now we are developing a platform for training for healthcare professionals using some algorithms based on artificial intelligence. Now professionals can practice clinical cases talking with a screen instead of only reading or practicing with some buttons in a screen. Other projects that we've got, now we are working hand to hand with the Spanish Health Managers Society to improve, to boost innovation into hospitals, to help health managers understand how they can implement artificial intelligence, new leadership models, not only in the theory, but with cases that they can easily implement. And on the other hand, all this was about digitalization and technological tools, but we also work with humanization, and this is probably even more important. Patients are, at the end, the most important of all the system. Is the reason why we all work. Now we've got a certification in humanization. We've been in more than 70 hospitals this last year here in Spain and in Mexico, and we only try to facilitate the implementation of specific measures that improve the quality of care offered to patients and the quality of the offered to professionals, helping them implement small things that can be a great change. If you are interested, or we can be of your help, you can find us here in the Barcelona Health Hub building in Barcelona, or you can also contact us at hello@edrix.net. hello@edrix.net. That's it. Thanks for everything, and see you soon.
Thank you very much, Xavier. Thank you, all of you, for your very interesting presentations. Now, show and tell second part has arrived to its end. So now it's time for second rest. Take your lunch, enjoy your legs, enjoy your rest, stretch your legs, and see you here at 2:30 p.m. Spanish time. Meanwhile, don't forget to make your networking. You have your online booths, and you can use the app to networking too. And for all those who are just here, remember that all the physical booths are located downstairs, so don't forget to visit them and enjoy these times. Bon appetit, and see you later. Welcome back to all of you. I hope you enjoyed your lunch. Did you have time to stretch your legs? Maybe having a Spanish siesta? No, I'm just kidding. Not too much time for this. But for sure, time for networking here physically, and of course, and I hope so, by using the app we have ready for you. So now, time to carry on with our keynote of the day. And we are going to talk about co-designing the future of health. In the past 18 months, we have radically shifted how we deliver healthcare. While many innovations used today seem new or novel, the truth is patients have been asking them for years. So, what trends do the future hold? Let's ask the patients to find it out. Today, we are going to talk to Jen Horonjeff. She's founder and CEO of Savvy Cooperative. Jen has named one of the 50 most daring entrepreneurs by Entrepreneur magazine for her work at Savvy. Jen grew up with multiple autoimmune diseases, survived a brain tumor, holds a PhD in environmental medicine, and is a health outcomes researcher, human factors engineer, and FDA advisor. So, Jen, from US, so good afternoon here, good morning for you. It's a pleasure to having you here. Thank you very much for your time.
You were actually joined by my colleague Jahed, who is with you in person. So he looks exactly like me. He does not. But thank you so much for having me. This is something very near and dear to my heart, to be able to talk to you about the patient journey. So I'm going to spend some time telling you a little bit about my own personal experiences as I have been introduced as a patient. And that is something I identify with first and foremost. And it's because I was diagnosed as an infant with juvenile idiopathic arthritis and a lot of other autoimmune diseases since then, both rare and more common. So I've really been living that patient experience since day one. I had the joy of being diagnosed with a brain tumor that was surgically removed about 9 years ago. And so at this point, I really had a whole swath of different experiences. And I'm going to tell you about little vignettes that have happened along the way that help to exemplify what so many of my peers as patients we go through day to day, and how we can use those experiences to help you all create better products and services, because nobody wants to improve healthcare more than the patients. And so we really want to partner with you to do that. And the most helpful thing is understanding what it is we go through. So as somebody who lives with arthritis, I've had to go through a lot of various different tests, as well as tried a lot of the new medications as they came out into the market. And the thing that I started to feel is that at every juncture, there just started to be more and more barriers for me as a patient to try to take care of my own health. And that's why in healthcare, when people talk about non-compliance, it's really a challenge for me as a patient to reconcile that with the fact that I'm trying my darndest to do what my care plan is telling me to do, but it's all of these different friction points. So I'll give you some examples. So years ago, I ended up having just horrible disease of my arthritis in both of my hips. And my rheumatologist said, we need to get an MRI first so that we know what to do to put you on the right medication. So she ordered me an MRI. Now, I live in the United States, so our healthcare system is a little bit different here. But that meant for me that I actually had to get prior authorization from my health insurance before I could get my imaging done. And what was a really urgent thing to my rheumatologist and to me as a patient, it was not urgent to my insurance. And so I ended up waiting 2 weeks before I could get that approval to get my scans done. So flash forward then, I get my scans done and get prescribed a medication. But this medication, one of these biologics, I actually couldn't go on until I had failed other medications first. Now, I had been on other biologics before, but because of changing health insurance, it actually meant that I needed to start all over again. And this is not what my provider tried to prescribe me. It's not what I, as a patient, knew I needed to try something different. But again, I had no control. And that's what it feels like for so many patients, is we're trying and we just can't get the care that we need. So this is actually a different medication, but one of the biologics that I was then prescribed created a whole new set of issues when I finally did get the medication. Now, if you're a patient like me, you've been injecting yourself with different biologic medications for decades now. But there was one particular medication that the needle came in the syringe, but the needle felt so blunt. The best I can describe it is trying to inject yourself with like a blunt pencil that you just couldn't quite get into your skin. And it would literally kind of like bounce off my stomach or my arm whenever I would try to inject it, which created a lot of anxiety for somebody who is very comfortable with needles. But it just always, I had to psych myself up to try to jam this thing in that just didn't want to go into my skin. Let me tell you, that is not an ideal patient experience. Another story that I find quite interesting is, as was introduced, I'm a human factors engineer by training. And when I was in graduate school, it was actually my department that was testing out a new design of a new syringe. It was meant to be an incredible patient experience because this new syringe had a longer arm for the patient to hold. It had a different way of pulling off the cap. It was going to be just the best different type of injection. Well, everybody in my graduate program knew that I had inflammatory arthritis, and I had hoped that I would be part of this project to test out this new syringe. I wasn't, and that's okay. But flash forward a few years later, and I was prescribed this medication. I thought, oh my goodness, it's going to be the best injection of my life because they've designed it well. Well, turns out when I get this new syringe with all the fancy new enhancements, I couldn't hold it properly. And the reason why, I believe, is that somebody without arthritis, without taking these types of medications, was probably the one testing it out. And biologics, you can inject in different places. And, be it stomach, leg, and arm. And now they've stopped recommending the arm so much. But if you're from the older guard, an older generation like myself, that's where so many of us like to inject, especially if we have to do it regularly. Many patients don't like to inject their legs because it bruises so easily. So we rotate through stomachs and arms. But if you all sit there and you think, oh gosh, how is my hand holding this device if I'm going to go for my stomach versus my leg versus my arm? Your hand actually changes and your wrist changes. And because this new arm was developed on the syringe, it made it so those of us that were trying to inject our stomach and our arms couldn't hold it properly. And so this whole innovation that had spent time and money was not useful. I couldn't even use it the way it was intended. Now, here's the real kicker. Even if they had tested that part out properly, now with this longer arm, it would not fit in the sharps container that I was provided. So here I was, a patient, finally giving myself an injection, in other types of injections with these blunt needles, and then I go to put it in my sharps container and it won't fit. So I get a pile of syringes that I would collect in a Ziploc bag and bring to my rheumatologist. This is not how it was intended to go. But unless we understand the entire patient journey, we're going to keep running into these things unless patients are helping us identify some of these problems. Now, this is happening in the health data and digital health space as well. There was one time when I had waited about 6 months to get in with a new specialist. I was so excited. I was finally going to try to get the care that I needed. And it was about a week before my appointment, and that doctor's office called and said, we need to get your health records from your other providers. I said, no problem. You know, I have my whole patient portal here on my phone. I've got all my apps. And they said, no, we need your whole record, and you as a patient don't have it. Only the doctor in their office in the health system in the United States has that record. We as the patients don't see the doctor's notes. Maybe just our lab results or our COVID-19 vaccine proof, but we don't see everything. And so here, and again, in the United States, we're still using fax machines to get our health records. And what this meant for me as a patient is I had to call my other providers, fax them over the authorization to share my records, and then have a CD with my data sent to me. And I don't even have a CD-ROM on my computer, so I had no way to read it. Let me tell you, this took so long that I missed my appointment. I had to reschedule the specialty appointment I had waited 6 months to get because I couldn't get the data that I needed. I thought I was being the most prepared and informed patient. I work in health technology and healthcare, but I couldn't overcome this. What happens to other patients that don't even have, the same access and privilege that I do? What are their experiences? And let me tell you, I don't even know what all of them are. And I think that's important for us all to remember, is that we can't think that we understand the patient experiences of other patients, that we aren't a part of their communities. And so that's something, as we start to develop out new, innovations, we really need to be thoughtful about the different experiences, be it the country differences that I might be talking about with some of you, be it the therapeutic area differences, or those that come from underserved communities that don't really have a seat at the table. So we're not hearing their voices. So long in healthcare, we've even just sort of ignored the patient voice because there are so many other stakeholders involved. But what happens then? Earlier this year, as many people do at the beginning of the year, they make predictions about the latest trends. And so this past year, I was seeing, come January, people were talking about how hot digital health was. And of course, telemedicine is taking over the fact that the pandemic has forced us to do things virtually. And I sat here reading trend after trend and each different report rolling out. And I was just thinking, my goodness, patients have been talking about this forever. Decentralized trials, how novel that was. Patients have been wanting to be able to participate from trials remotely for years. They've wondered, why do I have to go into a site? Why do I have to pick up my life and travel and relocate to go to a center that just happens to be doing the clinical trial? Why can't I do it from my home or my local clinic? Why can't I be using telehealth to connect with my providers, especially if it's just a quick check-in? Why do I need to get up, take time off from work, find childcare, and go to an appointment where the doctor may only spend 5 minutes with me? All of these things patients have been asking for. We just haven't been listening because we didn't have the same incentive to listen to them. But now that the world is turned upside down, we really need to start listening, especially if we care about things like diversity, equity, and inclusion. We know that COVID-19 has disproportionately affected certain communities, and it's finally allowing more people to see the health inequities that exist. But the good news is that there are things that we can do about it, but we can't take action until we understand what those experiences are. And so I'm hoping that now, as the world is starting to come back to life, either in person or in these virtual spaces, that we can see that there are opportunities that we can learn even from an event like this. That you all get to be there in person, but I get to chime in virtually. And that's what so many patients want. They want options. They want to be able to pick the right thing for them and their families. I get asked a lot, like, what do patients think about this, that, or the other thing? And I try to remind people, I am one individual. Patients are not monolith. There are so many different priorities between patients, between their care partners or family members that may also have different priorities that certainly differ from what a provider or a sponsor or a health plan is thinking about too. And so when we think about how can we create a more inclusive healthcare ecosystem, we really want to start to think about working with those patients to get their input into what we're doing. And here at Savvy Cooperative, we've really been grateful that we've worked with so many companies over the past year and a half to help them rethink, what does healthcare of the future look like? And how can we include patients in that conversation? And it's been incredible to be part of designing some of these things that are hopefully going to become ubiquitous. This past year, we've been spending a lot of time working with AstraZeneca to help them understand how can we rethink decentralized trials and supporting patients from home. AstraZeneca has really done the work to think about how can they develop out different support for patients. How can they end up testing out their new app that's going to help patients along the way? Thinking through what kind of information does a patient want, at which times, and through which channels. It's been great to see them actually make tangible changes that is going to make the patient experience in trials not only less cumbersome, but feel more supportive and safe, especially if the patient is participating so much from home. We've been able to work with Boehringer Ingelheim on working on a lot of initiatives around diversity, equity, and inclusion. They've set up a diversity and inclusion patient council, which we've been helping to facilitate, so that when BI has questions and they want to make sure they're thinking through all of these different things, they have a team of patients that they can turn to, that they can say, with vulnerability, we don't have the answer, but we want to include patients in the conversation to help us figure it out. And when we think about diversity, this of course can be race and ethnicity. It can be around gender, sexual orientation, age. So many different things factor into this. And one of the recent conversations that we were having was around even thinking about how is data being analyzed in these different groups? Because people even care about what that is. And so we really need to be thoughtful and have these conversations so people feel safe. We've been doing a lot of work in even digital therapeutics because there's so many more that are coming online now, but we need to get that perspective. And as somebody who's grown up with a pediatric illness, it made me very happy when we worked with Achille to help them think through their digital therapeutic for children with ADHD. Just because they're kids doesn't mean that they can't share their perspectives. And so we were grateful to be a part of that and helping them facilitate those conversations. There are so many different ways that we can be leveraging different types of technology in this space. Even the types of technology we might not think about can be supportive for patients if it's inclusive. Recently, Amazon just released a new feature to allow patients with stutter and stammer to be more readily heard and included in using something like an Alexa. And we were grateful to be a part of helping them get that feedback because we can't create innovations if it's going to leave people out. We need to be really thinking about who else are we not hearing from? And if we don't hear their voices and include them in the conversations, we'll never know what they're needing. And I'm going to leave you with thinking about who is included in these conversations. I have the absolute privilege of speaking with you today, but I recognize the privilege that I come from, being somebody working in healthcare, who has a PhD, lives in New York City, comes from a certain background. And I want us to be challenged to understand that when we think about including people, it's not just only from different communities, it's also thinking about health literacy. And are we only talking to higher level patient advocates because they can speak our language? Or are we doing the work to make sure we're including people that don't know what a clinical trial is, has never thought about having their Apple Watch, linked to their patient portal? How can we make sure that just because they don't have maybe the same language that we're all talking about these things doesn't mean that their voices and their perspectives are any less important? If we truly want to create a more patient-centered future, which I do believe if you are at this meeting that you care about that, we need to include the patients. We need to do what this handy sign behind me says, which is ask patients. I started off with this and I'm going to end with this. Believe me, nobody wants to improve healthcare more than the patients that are trying to manage their conditions while navigating through this process. So include us in the conversation because we're going to get there faster if we can work together. I thank you so much for your time, and I'm excited to see what kind of questions you have. I know we're working in this virtual environment, so I'm getting some beamed into me right now. I'll take a peek, but certainly if you have any other questions, please let us know. All right, here's one from the audience. I'm going to read it to you in real time. The patient journey of the future is not going to be a singular journey, as you said in your talk. What are actionable ways that you've seen in the market, such as AstraZeneca's work, for those of us building products to ensure that patient journey is diverse and inclusive? That's a great question. And this is the whole thing, is there's also no recipe for patient engagement. It can look differently depending on where you are in your sort of product development. Sometimes you're looking to go to a broader group of patients. And that's where I think people usually jump to thinking, oh, I'll send out a survey. But surveys, especially if they're larger surveys, can be more quantitative in nature. And quantitative data generally gives us a signal that something is wrong, but it doesn't tell us how to fix it. So what Savvy does a lot of is we work more in the qualitative space, the more richer conversations with patients to help troubleshoot some of these things of understanding, why would you not doing something? What's happening? And so that's where I think understanding where you are in the process, you might want to go for a larger sample, and then you have some questions and you're going to spend time doing some interviews or different types of forums, getting direct feedback from patients. When we do things and support companies that are maybe getting into a new therapeutic area, first and foremost, we have so many conversations with patients to understand just like, what are your experiences? And it's really important to not bias them with a solution, to be like, hey, do you like this app? We're not even there yet. We need to make sure that we're teasing out some of these different things before we're kind of in solution mode. But then, like I mentioned before with AstraZeneca, with things like digital therapeutics, there then comes a time when you want to put these things directly in front of patients, be it a prototype for them to actually test out and say, I don't understand what I'm supposed to do here. This is really confusing. Why is it asking me this? This should be mixed and going first. So all these different things. We even do this in marketing campaigns. If you're trying to recruit for patients in clinical trials and the materials make no sense to them, that's not helpful either. So there's always an opportunity to ask patients. All right, let me see what else we have here. For those who manage resources to invest in these ecosystems, such as pharma and health and hospital systems, what is the value of patient diversity and inclusion to the stakeholders building the journeys for patients? This is a great question too, because truthfully, there is a business and a value proposition for those like the hospital systems, for the pharmaceutical companies, you name it. Obviously, from the patient lens, I'm thinking first and foremost for the patient, but I understand that there has to be a business case for this. But even if you think about something like a clinical trial, we know that amendments to the protocol slow the entire trial down and end up making it last years longer, which changes the net present value when it hits the market. And so if we actually did the work up front to talk to patients to understand, what is this protocol? Is it too burdensome for them to stay into? How can we look at that before we launch the trial? And so that way we can save so much time. In health systems, people are trying to think about patient engagement and how can we keep the patient more involved in their care, not missing appointments, all of these different types of things. I mentioned many in sort of my opening statements that there were so many things that I, as a patient, couldn't follow my treatment plan. I had to cancel appointments because the system wasn't working together. So those are different ways that you can make the business case for why it's important to include patients. here in the United States, we work a lot in sort of the Medicaid and Medicare population. And it's something that we hear about all the time is how can we make sure that this certain community is also feeling engaged? Otherwise, we're going to lose, a lot of people from the system. And so I'll bring it back in my closing seconds here just to say, it's for the patients. They want to have health back. And so it's really important to make sure that we're working with them so we can create the best future together. Thank you so much for your time. And I hope you enjoy the rest of your conference.
Thank you very much, Jen. What an emotional presentation, don't you think? Thank you again for your time, for your participation, and so on. Well, it's time to move on. Let's continue with Novartis, and they will be explaining how medicine evolves thanks to collaboration and innovation. Clara Cuervo, Novartis Biome Spain lead, and Take McCarthy, Legit Health, they both will be talking about how can they find digital solutions that accelerate drug availability, early stage research, optimization, and access to clinical trials. Novartis is also working, for example, in partnership with healthcare professionals to accelerate research and development, creating a range of services that extend beyond just medicines. They will also be able to present you an artificial intelligence project that Novartis is working on for the early detection of skin pathologies. So, let's stop waiting any longer. Here with me, we have Clara and Take. So, welcome on the stage.
Thank you.
And the floor is yours. Thank you.
Thank you.
Thank you.
Thank you, everyone, and thank you, Barcelona Health Hub, for organizing the summit. It is great to be here with all of you today. So my name is Clara Cuervo. I'm the Biome by Novartis lead here in Spain. And today we wanted to share with you a little bit what Biome is and really how we work. But first, we wanted to share a question that we ask ourselves every day. And it is, what if we could build bridges between scientific knowledge and technical expertise to create high impactful digital solutions to reach twice as many patients twice as fast? This is our North Star in all the projects that we do as Biome. And the first thing that I wanted to share with you today. But first, we have a little video to share with you about Biome. So if you can please pull up the video. thank you. I hope that's a little bit of a teaser before we go into a little fire chat with Legit, which is one of the amazing companies that we have here in Spain. That it's a legacy of a team of young entrepreneurs that were born in the University of the Basque Country and really step out of a research project, really looking into how to diagnose skin pathologies through photographs. So today we have here Tai. Thank you for being with us today. And we want to learn more about your solution and your experience and working with Novartis as well. So first of all, how all this idea of working from scratch from an idea to a solution came about?
Well, it's quite challenging, and many people know our background as, let's say, scientists or even engineers, but not so many people know that for us this is personal because we come from a background of being patients with skin pathologies. In my case, my family, let's say, has been less lucky than the average with skin cancer. And Andy, for example, my co-founder, she has been experiencing skin conditions simultaneously, a few of them, since a very young age. So for us, that's what it means, really. That's why it's, I think, more challenging, because we really want to tackle the problems, but it's also more empowering. So when we saw this chance to help doctors, help patients, we right away just jumped in, because that's a vision I think we share all of us in the team, that the best way of helping patients is helping doctors, which I think is something also you agree on.
Yeah, absolutely. So it's great to see your passion, to hear it, and the progress that you have made. Legit right now can really read images and diagnose more than 200, I think, skin pathologies. But the truth is that the market is full of apps that can diagnose skin pathologies. So how would you define or describe your unique value proposition, and what differentiates you from others?
Yeah, that's a very good question. So there's some technologies that are solutions, but sometimes to different problems. So I think that it's easy to look at computer vision diagnostics and look at one and the same, but sometimes the solutions are solutions to different problems. In our case, we're tackling two different problems. One of them being the fact that there is not really what, in value-based healthcare terms is an effective communication between doctor and patient. And that's something we experienced, which is the doctor needs a clinical language and expresses themselves in a clinical language, and the patients, they have their own language. And it's difficult to translate sometimes from one to another. So we try to tackle that. And technologically, the other problem we're tackling is the challenge of severity estimation. So it's not really answering the question of what does this picture have, what is the pathology in this picture, but rather how bad it is, what's the severity of that pathology. And that's a way different topic that is a very different task for doctors. It's quite tedious, and it really comes with some challenges. And when you put those two together, it turns out that helping the patient measure the severity is really the best way of translating in clinical terms how bad they're feeling. And we integrate, of course, this technology with, so you have the automatic outputs for the algorithm, but also patient-reported outcomes for quality of life and burden of the disease. So that's really our niche, our focus.
That's a lot. Thank you so much. So we've been talking a lot about patients, about technology, about the doctors. So really, what was your experience building, a prototype, testing in the market, and then working with Novartis as well over the last year and so?
Yeah, wow. Yeah, so I think creating a product is always difficult. Creating a great product is difficult, and this is maybe even more true in healthcare. So you need to gather minds from very different fields. Of course, you need to ask patients, as we were talking about, but obviously doctors. And not only doctors, but doctors who are specialists on specific pathologies with their specific, inner workings. So working with Novartis has been really cool in this sense, because your ability to connect with really relevant stakeholders is really amazing. And when we saw that video in the beginning, for some people maybe maybe some corporate explanation, but for me it was quite inspiring. Even I wanted to clap, because it is something that we have been living ourselves. The fact that we enroll in this program, how Novartis has been helping us get in touch with all these people and grow the solution. So it's quite powerful what you're doing.
Thank you. And there are many people in this from Novartis here that have worked on this project because it really interacts with different business units and profiles in our company as well. And I'm sure they're echoing that it's been great to learn as well from this experience. So there might be some entrepreneurs here in the room as well that are trying to or are working very hard to make their ideas or to test them. What advice would you give them?
Don't do it alone. That would be, I think, the most important thing. Us as founders, there's 4 founders, and I wouldn't have it any other way. But then again, we work really closely with doctors who are experts in their pathologies. We work with Dr. Jesus Garciazabal for skin cancer. We work with Dr. Fernando Alfajeme for HS. So for different pathologies, we have to work with different experts. So that would be definitely my advice, and that really ties in neatly with the previous question, which is engage with even other stakeholders, such as pharmaceutical companies that have all this knowledge about the pathologies.
So thank you very much. I know it was a short chat, but very enlightening to be able as well to zoom out from our day-to-day project operations and go a bit further and share that with people in the room. And I think we're out of time, but it's been great, and I hope everyone here in the room really catch up, or even by the chat later, to learn more about Novartis Biome and Legit as well, and how we work together.
Thank you so much. It's been great.
Thank you so much, Tai.
Thank you both for sharing all this information, for sharing what's new on Novartis right now. Thank you again. And well, time to carry on with the second panel for today. We are going to talk about patient journey, or how we put the person in the driver's seat. But before we go ahead, just a second, remember that you can ask your questions on the app or website, so don't hesitate to do it, because during the panel, Frédéric Jordax will answering.
Yeah, I will try to do something with your questions.
So, in order to start the panel, first of all, Frédéric Jordax, be welcome on the stage.
My pleasure.
CEO of Doctomatic and ambassador of BHH. So you will moderate the panel?
Yes, I'll try to do it myself.
The stage is yours.
Okay, thank you so much.
Your collaborators are just right here.
Okay, so I'll try to start with some words about that. If you know, enlightened absolutism, according to Wikipedia, so you know, also called enlightened despotism, refers to the conduct on policies of European absolute monarchs during the 18th and 19th centuries, and can be summarized as everything for the people, nothing by the people. This sounds to me a lot like how healthcare has been working for years and years. But now the revolution is arriving. The revolution is here. The revolution is coming. We are here ready, thanks to technology, thanks to a change of mind, thanks to a change in the citizens, thanks to a change of patients that can be more and more empowered. And the people that now wants to keep healthy, that wants to keep care, to have care nearby, and well, we have experts that come for our future as a patients that will help us to see how will be that in some years. And well, the point is that we have here Ms. Teresa Ramos, Head of Personalized Healthcare in Roche Pharma. It's here, on the other side. We have also Eva Turk, Senior Researcher from an European project, this European Gravitate Health, and from the University of Oslo. We have also Stefano Deliguoro, Head of Digital and Direct Business in Zurich, Spain, the insurance company. And last but not least, Thibaut Jacquemot, finally I did, co-founder and CEO of Lilo Health. So thank you for coming here to Barcelona in some cases. So some of I think the half come from Barcelona and the area, the other half. You're
Barcelona.
Barcelona too, but he's not, no? Where are you based?
From Brussels.
Brussels, Oslo, well, and the Barcelonians. We play home in some way. Well, first of all, I would like that you shared with the people your drivers to get involved in improving this journey of the patient. So let's start with you, Teresa, for instance.
Well, I'm representing today Roche Pharma. I work in Roche Pharma, but as you may know, Roche marries together the diagnostic piece with the treatment piece through a personalized healthcare approach. That's why I'm here. I'm the head of personalized medicine at Roche. And these are our foundations, the treatment and the diagnostic pieces. But we want to go much further and through data health, data health. And in this ambition of really boost this transformation, digital transformation in health, we are pushing and boosting some projects along the patient journey, in all the milestones we can face in the patient journey as early diagnostics through early detection through data imaging, for example, advanced imaging, care planning through clinical decision support tools, for example, or what's more linked to our topic today, the patient's empowerment through remote digital monitoring tools. So we are working in these areas, and that's why we are fully involved, and we want to bring value to this, because we think that it's not, and we have to tackle this huge challenge in a collectively way. We have to embrace this complexity by engaging collaboration with all stakeholders, and that's why I'm here to create.
We will go deeper in that later. And Eva, what about you? Why in the academia have you focused in patients?
Yeah, well, my driver is actually personal. I come from a medical family, and since I was a kid, I was listening to issues that are not going well in the health systems. And then I remember once asking my parents, but did you ever ask the patient? So that was actually my driver, that I decided not to study medicine, but I always wanted to work with health systems and do more research with regards to how can we then, what you said, connect the different stakeholders and work towards that. And since then, I've dedicated, in a way, my career to person-centered care, and then now going more into finding the digital solutions with co-creation of those.
Okay, and Stefano?
Good afternoon, everybody. Thanks for allowing us to be here together with us. So essentially, from a Zurich perspective, we think that, and me personally, as head of digital, we think that now we are completely in a new different area of health and the digital space, allowing the patient to become, let me say, a satisfied patient, because we will have a big opportunity altogether to bring a complete different customer experience in this sense, and solve much more problems, thanks also for the digital-first solutions.
Okay, thanks. And Thibaut, what's doing a startup guy like you here? What are you doing here?
Well, I would say the first thing is, on behalf of our company, that's what we do. So we build patient journeys because we tremendously believe in the impact it's going to have on patients. And on a more personal level, or more the reason why we started the company is because my founders and I had in our families health issues that we thought, where we thought the experience could be improved, but also we think that there are ways where we could have detected some elements earlier and potentially prevent some outcomes. So this is what drives us. Yeah.
So then, with the second question, it would be about you that have specialized your startup on patient journeys. How do you see the impact that can have this analysis of this patient journey and the changes that will come on that?
So there's different definitions of patient journeys. I think there would be three that comes to mind. The first one is when you optimize the patient pathway or the treatment pathway on the HCP level, and that adds a lot of value for doctors and indirectly to patients. The second one would be the collection of data that can help you predict outcomes more accurately and then act earlier. And then the third one, which is the one that we focus on, is to improve the engagement for patients, so to make sure that they take ownership of their treatment, which increases adherence and indirectly also the health outcomes.
Okay, and Stefano, how do you see then the impact that can have for your company at the end of the day?
Well, first of all, we would like to shift a bit from patient to user. So, and because patient, in my opinion, I mean, is just a translation, but is have a not bad, but not a good, let me say, meaning.
Well,
no?
Sooner or later, all of we will become patients. No?
Yes, but the point is that we would like to change the paradigm of the health and also the health insurance more in the predictive side. So helping the customer and the user to, let me say, change their habits, change the way they interact also with the company, not be there to support them in case of an issue, but try to also change the way how they could start have their health life and having much more, let me say, support from the company before an issue comes, and therefore change completely the paradigm of the insurance concept itself and be more an advice for the customer during his life or her life, more than supporting in case of an accident or something happen and we have to react, while if we can change the healthier part of the customer life, for sure, also from an insurance perspective, we will be much more satisfied.
It's more prevention, focusing in the pre-patient journey, let's say.
Prevention, and then the second part is more on the probably personalization. So now also the health insurance is quite almost the same for everybody, and there is no differentiation based on communities. While we think that thanks also to the digitization, we can really target with specific services with these communities, like the Health Hub, for example, to increase really the personalization for specific niches or community of customers.
I will have dozens of mails asking me to talk with you.
No, so I didn't say this at the beginning, sorry. Before you leave, you have to do an insurance with us, so stay here, and Mark will take your data.
But if I may build on that, what you just said now, I feel that in health systems across the globe, what we see is this perverse financing, right? That we finance care, and when we were discussing a little bit, we don't speak about healthcare, we speak about sick care, right? So what you are actually saying now is moving into the actual healthcare part.
Absolutely.
Interesting. And what about in this patient journey that you have been working with in Roche? Do you have? Can you explain a little bit more about the patient initiative?
Well, it has, I would say, it's another aspect of the patient journey, what we are tackling and we are working in. And I will focus on the most, I would say, connected part of our work with today's roundtable. We are especially working in remote in monitoring tools for patients that really help them self-manage their disease. So we are speaking of diseased people, not healthy people. And, but these tools are aimed really to educate the patient, to provide the patient the materials, the information they need to be able to track their disease, to track the symptoms, so they can really drive, as the title of today's session says, that drive their disease course, you know. And by enhancing and empowering patients digitally, we also are empowering the whole ecosystem. I mean, we are empowering the clinicians, the care team, because they are also more empowered to make the right decisions in a faster way. They feel reassured when making decisions. Also, the healthcare managers have more information to be more efficient in terms of workflow, because they can avoid unnecessary clinic visits, for example, and be focused on the patients that really need attention, that really need to be seen. And you know, by these remote digital tools, we are really benefiting all the whole community. And,
this is interesting because all of you are talking about digital health as the trigger of the change, that now we can do things. So do you think that really the traditional ecosystem, the healthcare ecosystem, is ready to understand this value that this new technology has, according to your experience? So you are involved on that 24/7. So what do you think?
Yeah, well, today, Christian, I think in the opening session has mentioned that we are more ahead in the technical part of this patient journey transformation and evolution, rather than in the regulatory reimbursement, you know, all different aspects. So I think we are falling behind in acceptance of data sharing, for example, and data access. We are falling behind also in integrating into the healthcare, into the hospital's information system, because this is needed to share data.
But this is the point. So are they waiting for you in the door, asking you, please come to change things?
Of course, no. And also the reimbursement and the regulatory aspects that. So
even insurance companies maybe, or not? Do you think that you could do things with Zurich, for instance?
Why not? I mean, that's what we have to do, to really create new pathways to make it happen. Pathways that nobody has walked before. So, yeah, that's why this is a starting point, this session, for example.
Yeah. Well, I guess I hope it will be at the point, no? But I don't know.
Yes, and I feel also that, for example, from the European Commission with the Innovative Medicines Initiative, where it's actually building, you know, consortia with private and public partners, and this is where our project, Gravitate Health, is funded, is actually showing then how we can then really work together towards this digital transformation. But for me, the digital transformation, it's not only about the solutions per se, right? It's also how do we tell the story, the narrative that we use. And for example, in the Gravitate Health project, which is really speaking about the patients, right? It's about structured product information. So the pharmaceutical industry gets the medicines. You take the patient leaflet, product leaflet, you open it, and there is like so much stuff that most of the patients either do not read it or do not understand it. Health literacy is a huge part how we can then build on this digital transformation as well. And what we are trying to do in the Gravitate Health project is together with the patients co-create how we can bring different types of information so that we can put it in together, that it's then personalized as you said, right? And this part is then with regards to transformative ways, right? The patients actually, we are building trust together, and this is how we can actually make the shift happen by co-creation and collaboration.
So the way to change this, to jump these barriers that we have, has to be how? With the patients, collaborating with patients, collaborating with economical agents like insurance companies?
It is collaborating.
Putting startups in the middle?
Together, and it is having certain standards, of course. But what the thing that is missing in many healthcare systems among different stakeholders is the trust. So what I feel that what we together need to be much better on is how do we build trust together. And this kind of platforms actually start opening up, that we see that it's not the dark side or the bright side, but it is that we have a common goal.
But most of us as patients probably would trust on digital health, digital tech. Even probably we are asking, well, I mean, younger than me, I'm an old guy, but I mean, millennials are asking for this kind of tools, I guess. So how do you think that we could convince the guys, the people that has the money or that has the power to use that? Should we go with the patients to ask for that? Which is the pathway for having that? So consortia, okay, but how we can make this stronger? How can we move forward on that?
But I think this is how we then build the movements, right? The patient voice hasn't been heard in the last 100 years. So now it's actually the time that the patient or the user's voice is heard. Yeah? And then we're going to go more into the preventative care or in that sense to how do we actually keep the patients out of the hospitals, right? That should be the goal that, well, maybe not everybody, but, but at least those of us who work with health systems would aim for.
And, can I add, build on Eva's comment? I think we have to build on trust, of course, but also on evidence generation, on clinical evidence, because if not, if we are not showing the impact in terms of clinical outcomes and in terms of cost efficiency or effectiveness, we are not going to convince anyone.
Yeah, but they can show you a list like that of clinical evidence that's, I mean, somewhere hidden somewhere that has been. There are lots of evidence, lots of projects, lots of things that have thousands of pilots. I remember other Barcelona Health Hub editions where we talked about the piloting, about the pilots. So many pilots and and we don't have planes. Okay, so we have pilots and nothing happens. And this is the problem. So probably we have now the patients waiting. We are talking about how ready are the patients. So they are focusing in the self-care. They are buying wearables. They are using them. They are asking for new products. Zurich is looking at this, for instance. I mean, okay, we have all that, but instead of all the evidence, we look for more evidence. No? So it's like we are stuck on the analysis and we don't go forward. Why?
I do feel that evidence generation is a crucial part of whoever is developing any kind of solutions. Either this is like from a pharmaceutical industry where that is really well regulated and so on, or also now that with the new medical device regulations and so on, I think it is becoming more important. But another thing is also with health technology assessment. Patients have been asked to actually be in committees when they discuss, so different countries with regard to health technology assessment have different committees and different institutions working with that. But it's been now from the past 5 years actually that patients are invited. So again, I think there is to have this educated information for the patients, that patients also can understand what does the clinical trial say, or that the HTA that has been put together.
So empowering patients, it's also putting them in the decision table.
Exactly.
But then
it's about them, or it's about us.
Yeah.
I think to recoup on that, so one main issue, and potentially could be the source of there's a lot of pilots, but it's not properly implemented, is because these solutions are not actively being prescribed so much. Even with DIGA in Germany, it was 30,000 patients being actually prescribed. And I think that's also our approach, to first focus on adding value to HCPs, to doctors, adding as much value as possible for patients, because they also need to use it. And I think it's a wrong assumption that if it's prescribed to them, they will use it. And I think that would be a strong foundation, first getting doctors used to recommending these tools and prescribing them, and then we can look at how we can generate the best evidence using these technologies.
I don't want to be the bad guys, no, but essentially, if we look back 4 or 5 years ago, my perception is that we use this pilot or this test more to convince ourselves that the technology and the digital could really supply and give much more, let me say, satisfaction than and fast path for the customer, for example. But there was always the question internally in the sectors, in the industries, of, yeah, but this really is, let me say, could supply, could reinvent the health industry as well. Now we have to shift, and I have seen in the last years that we have shifted to the patients, really say, yes, we now trust the technology, but we have to make the customer happy about that, so they have to trust the health, the digital health, the e-health part, because it's very simple to identify the best product, but if you don't achieve that the customer consider like this, you could be stuck. And therefore, I think that in the last years, the effort has been more to how we reach the patient and how the patient will be really co-creating the way how we go to market with this, because the technology will not anymore be the problem.
Like one question for you. Do you think that COVID has changed, has accelerated this path to the digital approach for the patient or for the citizen at the end of the day?
Yeah, absolutely. So the point is that this was, let me say, something that they were obliged to, okay, because nobody could reach an hospital somehow. And therefore, telemedicine, for example, was something that allowed them to reach out the health industry. But essentially, they identify precisely this path, that actually more than 70% of the issues were solved directly by telemedicine. So, and then you start building this trust. And now what we have seen, like in other industries, the customer is keeping these new habits because they see that it's much more efficient and also solve the same issues with less of time. So cost improve. You say before about how we can convince the economy, the industries like insurance or others to participate. Because essentially to convince this is the economics is important. The satisfaction of the customer first, but the economics are important. And the digital health help to reduce drastically the cost of it.
Okay, and Teresa, have you seen just post-COVID a change in the mind of your users/customers as hospitals or medical centers?
Well, I think especially in the first stages of the pandemic, there was a sort of obligation to boost different pathways to reach patients and avoid, or to continue the everyday, approach to patients. And for example, in US, we've seen many examples. But for example, Roche was obliged to create in a very fast way a mobile app to monitor patients who have retinopathy related to age, because the clinicians needed to know if they had to continue the treatment or not. So the patients were the owners of their disease at that moment through a mobile app and through a simple identification of shapes in their screen. They decided they self-managed and self-decided if they had visual changes or not, and they decided if go or not going to the healthcare system, to the institution, hospital institution. So for sure, COVID-19 has been a catalyzer.
But are they still using the tool? I mean,
yeah.
Because how much? 80%?
85% of people uses once or twice a week, and it's still there. Yeah.
So it has gone. It's now in the journey. Is part of the journey.
It has been kept in the journey, in the patient journey. Yeah. For this. This.
So this is one of the first real things that have been going on. But just this is a tool that works, so let's use it for longer than the pandemic. So.
And actually, this tool has completely changed how care is delivered. It's and we have many other examples in that.
Amazing.
Yeah.
And then talking about if is this the final goal? Is the final goal is changing with digital health this digital journey or digital patient journey, or that has to be a digital patient journey at the end of all that when the technology that Christian mentioned in the morning really gets embraced by the people of the money, by the people of the hospitals, by the doctors, by the healthcare systems. Is this the way? We want that? I mean, what do you think? All of you, what, I mean, is this, I mean, only this or more than that, or?
I think it's the most clear lever we have to deliver the best patient outcomes at, while reducing the cost for society. To me, it's the most clear.
It's doing more with less.
Yeah, doing more with less, because we have more people, more aged people, more chronic diseases, more people accessing to the healthcare system. So we have to be efficient.
And taking, as Stefan mentioned, taking in account the NPS or taking account how the people see that. It's not like they put me the technology. I really remember when there were people here in Spain asking that they wanted to go to medical centers because they wanted to be to have attention in the distance or by phone. So they were asking, no, I want to see my doctor. Okay, it's well, I don't see if it was a lot of people, but they had a lot of impact in media. No, it's like this digital revolution was not something that nobody was looking for. So they just wanted to have this attention. So there is not. Do you think that there is a perspective, a negative perspective of digital health for the citizens, for the people in general?
It's like, in my opinion, it's like in many other industries, no? So essentially, digital first is good, okay, and there will be specific, let me say, group of people, more the youngest one that will accept by nature, okay, and that, but the error that will be done, because this will be done like in banks or in other, let me say, environment, that we would like to digitalize everything, you know. And therefore, we oblige somebody that probably is in an emergency. No, you have to take a video call with your medical. Come on, guys, I'm suffering. So essentially, this will be ending in the middle, no? So where there are specific processes where we can take care of much more customer in the right moment digitally, and this will be efficient for them, will be a win-win for the companies and the patient. And other ones that should be still physical, but with digital, let me say, components that will also simplify, let me say, the journey and enhancing the satisfaction of the customer. That does not mean that if it is not 100% digital, we have failed. Absolutely not.
Eva, have you something in mind? No?
Yeah. Yes, I was thinking, as you know, we are human first. So we do need to have this empathy that comes when we are vulnerable as patients and we need help. So yes, the digital should accelerate the efficiency and diagnostics and all of these things. But I do feel that what medicine has been lacking quite a bit as well is this when you have the doctor-patient consultation, this empathic approach, and how actually patients feel when they are at the doctors. And this is where the digital solutions, this is where AI or whatever cannot replace, really. But what we need to do, or the hospital organizations, or if it's the governments, to find a way that this digital actually doesn't disrupt the treatment or the consultation in a way that, okay, now the health professional needs to put everything in the computer or whatever without looking at the patient. So these are issues. And for example, from our perspective in the Gravitate Health, where we speak about the understanding, how this understanding and accessibility actually then improves the adherence to treatment. this we can have reminders, we can have all of these different digital solutions that data brings in. But we still need to, as patients, we are the ones who need help. So we need somebody that tells us that we put ourselves into their power in a way to help us understand our condition better. And this is how we're going to then move the systems. So I truly feel it's a combination of both.
Okay. And I think, sorry, because
go
I'm
on,
always
go on.
have an extra comment all the time. But I fully agree with you, Eva. And I think that the digital assets, digital solutions are aimed to really unburden the healthcare systems, to release time for healthcare professionals, to provide more quality service, and a quality approach to patients. So that's why I think we have still to keep on pushing this approach.
So it's not disrupting healthcare, it's disrupting the time that to be in front of the patient.
Yeah. And this is what I mean. We need to find the way that it's actually, when we speak about patient journey, we want to have a seamless journey, right? That the patient doesn't feel, okay, now it's my GP, and what we heard today from Jen, and in the States, they still fax the medical records and so on. So we as patients, we just want to go, we need our GP, and then he or she should have all of the information that it's there and all of our history. And that also from the health professional perspective, that this, whatever it is, like the solution, the process is not, or that is in place, that me as the health professional, I don't have to deal with extra work. So some research that we did some years ago, it was the biggest barrier really with implementing the digital solutions is because it adds more work to actually already overwhelmed healthcare professionals, right? So this is where I feel we would need to have somebody else speaking here, how can we actually improve those kind of processes?
The usability is the myth of usability in healthcare. No? I mean, that's another interesting thing. Stefano was saying yes. I mean, I totally agree about how difficult it is to deal with the technology well, not in healthcare in general. I guess that sometimes you have the feeling that you are working for the technology, and not the technology working for you.
Given that the strategic guys will say, yeah, we need all the data, and therefore the pure doctor has to fulfill also data that normally it does not need, and this generate much more problems to the customer journey more than benefits, no? And this is normal, like the fact that sometimes we ask the customer much more information when we have them already. And it's just a matter of connecting the dots between different companies, and we speak about ecosystem, but then the company between them does not speak, no? And this is the first thing that we have to do to improve the patient journey more than inventing, let me say, new systems.
Interesting.
If I also I think on how the technology can help, I think it can also empower the relationship between the patient and the doctor, because the time that they will spend together and technology can actually help make sure that they meet. And when they do meet, then it's much more valuable. There might be data that make the whole connection more meaningful. And actually, we also have an interesting project where we saw that we did the patient interview at the start of the project, and we saw that there was a time where it was very important for the patient to meet with all the specialists, but then there was also 2 weeks where the patient would be feeling very lost. And then that's where the digital health can bring the emotional support. And I think here is a perfect example on how it can work together, always with the patient's worries and needs in mind.
Well, it's keeping the relationship, no? Because then the picture now that you're drawing is you go to the doctor or to the healthcare professional, whatever. You just have a very intensive experience for a few minutes, and then you disappear, and you stay 2 or 3 weeks, no news. Some cases, still you go back, and another 10 minutes, wow, over focused in a lot of data, and you go back home. So this is the traditional healthcare well, doctors visit, at least in my experience as a doctor. Okay, so you had the feeling of having the patient from time to time. Okay, yeah, he's back again. Let's have a look. Okay, then you have a lot of data, but no more news, no more information for the patient. And this, I can imagine, even if you are if you are healthy, you're a citizen, a customer from Zurich, for instance, looking for, okay, I want to be healthy on something. You can have a lot of data, but nobody takes care of your evolution. Nobody takes care of what happens, like they do with the sick patients. No? And I think that and this is your opinion, that there is a way that all of the people that are here and that are following that event at home, we are in the same page on that. So we know that there is a way, and we don't know which technology, if it's the technology you have, new technologies you get, but around the world there is the same idea. Okay, we have the tools. Let's use it for the best of the citizen or the patient. No? And this is an interesting point. But for me, for my entrepreneur side, is okay, and maybe supporting him a little bit about and how can startups help to that in this way, you know, in this journey, and how can we be in the table where the money is with the governments, with academia, with the big companies? How can we
with
get
academia?
inside?
There's no money.
There's no. Oh, come on, no, get out of here. So how can we be into these spaces, according to your experience?
I think startups could fill the gaps we find along the patient journey, and you are one more actor in this community, you know. Mm-hmm. So when, for example, we have to go to we can leverage, for example, also the policy initiatives we are seeing in the European Commission, for example. We see that they are organizing, you know, somehow the European health data space and pushing an artificial intelligence strategy. So we can pick the messages that could help us mobilize this digital transformed patient journey in our countries and work together, the industry, startups, healthcare institutions, you know, to work together to, you know, land on the, you know.
Messages accepted.
But, you know, we are all together and we have to really work collectively to make it happen. So, to me, you are
very politic.
No, but
everybody together.
No, but it's true.
An email. Give me an email.
And we are actually working with startups. We have a startup accelerator. Over there is the responsible people for this.
Get up, responsible of the accelerator. Get up, I want to see you.
So we are working with startups as accelerators to really meet the patient need.
Zurich, Stefano, Zurich, what about?
I will be less politically correct. I think that the more with the company than with the startup. Yeah. Because essentially, for me, like in any other areas of where startups are present, they have essentially two things that the incumbent, let me say like this, does not have. The first one is the skills. So this requires skills that the company does not have in the technology, in the innovation, and so on. And secondly, is the freedom of starting from scratch without any legacy, without any, let me say, boundaries in their mind about the existing process, the existing patient journey, and therefore they can be very focused on specific part of this journey and reinventing this. And therefore, the collaboration with them is amazing because essentially you can solve a problem without thinking on the entire journey, but just solving a specific moment that somebody take care from scratch without, let me say, any barrier or any preconception.
Okay. your Christmas letter to these people. Come on, it's the moment. It's the moment.
But I feel from our side, for example, from Gravitate Health project is also we have 11 different ecosystems within the project. So once we develop this G-Lens, as we call it, we want to, and I just met today our colleague from the Argentinian ecosystem. So it's also this kind of events that help us to connect better. But this is where the startup scene and the ecosystem help also, working together towards, yes, so how can we then test our solutions that is being developed in a huge European project, and to see, okay, does it work in Sri Lanka? Does it work in Argentina? What are then what is the feedback that we are getting back? So for us, it's also that it's not only a project of 39 partners, but it goes then across the globe because of the ecosystems. So this is also where the reach is so important, I feel.
So there's a lot of people working on that, and let's see. And well, this is a question that we were discussing before, and how can these ecosystems help to accelerate this personalized healthcare that we are just envisioning now? How do you see that? There is a business model that could help us, as citizens, as patients. Is there a business model, ideal business model for us?
Well, I think both in terms of prevention or even at a later stage. For me, the biggest barrier is always the adoption, whether it's a treatment, but also the digital tools. So I think collaboration and using these ecosystems, where it's key is to bringing actors together on maximizing the value for all the stakeholders. So, for instance, we're looking at partnership with other startups to improve the value that's given to doctors, other patients, or to help educate doctors. So I think it's difficult if we have a value that's fragmented across many companies. It will be a coalition of companies, and we work with pharmaceutical companies to sponsor our work, and we're starting to see that insurance companies also wants to get more and more involved, and I think we're getting to a path where it looks realistic that we can get there in the next few years.
Okay, amazing. Well, we have one question. First question. So the great Alina sending us one question that says, well, it's long. The operational issues for implementation are the real challenge as seen. If we introduce a service with a device or an app and the care support in the hospital, setting the clinicians do not take ownership of the patient management engagement, who is the responsible for patient usage? That is the responsibility thing. So, okay, we put digital. Who will be the responsible for this digital usage? In your opinion, your experience, what do you think? So it's tricky. And this part of this, you said clinical validation. The other thing is who will be responsible of that if something goes wrong. Okay, and this is the question also.
Well, I think we have to follow the same path as a diagnostic test, for example. The companies that produce this test have to follow a CE marked.
Well, it's the regulatory.
Follow the regulatory
path
framework, and as long as you use this test following the intended use, the last responsible for this diagnostic piece is the provider, the company. So we may shape the right framework, regulatory framework for software as a medical devices, for all these assets to have the same regulatory framework, so that everyone has clarity on what's the responsible for the use of this device. I think we have examples and a background.
Well, I'm thinking in some things and in different projects when everybody was blaming the app when the problem was with the Telefonica. Okay, hello, Telefonica. Okay, I mean, because there was no line, there was no infrastructure. So if there is not infrastructure, who is the one involved? If somebody dies, in your case, if it's a wellness situation, okay, today we are not so fit, no problem, but if somebody is sick and finally dies, there is so many people involved, so there is a complexity on that is not so easy. In our environment, according to the medical experience, everybody pays. So if pays the insurance, pays the doctor, pays the hospital, everybody pays to the one that has had the problem. So then we should add probably, in one way or another, do you see Telefonica or, well, the Telecos, wait, not Telefonica, Telecos involved also as responsible for these treatments? I mean, as part of that, should we add them?
It's a long stretch.
At the end, let me say like this, I oversimplify. The responsible in front of the customer is who is giving the service. That is the most important thing. Because at the end, now we should jump from one company, and we are expert on general liability, so we know that now we have to jump between all the companies that are there. But at the end, it's more how all the company act to solve the issue for this not being anymore. Because at the end, who is providing the services in front of the customer has to solve this issue. Unfortunately, if there is a die, it's a different topic. But at the end, let me say, it's like we had discussed about cooperation, like ecosystem. At the end, it's the ecosystem that has to solve the issue between in front of the customer.
Okay, and well,
what I think, Frederick, is that we are digital health is very nascent. We are in the baby stages, and we have to connect the dots. And what I foresee is that we will see a similar scenario as we can see in the diagnostic environment, really. Because
I do have a question with regard to, so now if DIGA and so on, if this is going to be prescribed by health professionals, right? It actually, it's on the same pathway as the pharmaceuticals, right? So then, and with the MDR and so on being here, I wonder if there should be, to draw a parallel to see how it's, okay, probably it's not so much on the adverse events and how we take the medication, but more with regard to, are you then compliant with this digital solution?
Especially because the solution can change in 2 years more than the pharma. So pharma is 10 years since you get the drugs in, and you launch it to the market, and you have 20 years of patent for you. But in digital health, you have the app, and maybe in 2 years you are out of the market. So this is a shorter way to work. So this is a good point. This is something to ask for. So a fastest way for not being like pharma, but being like some other issue.
But I can add that we're fully responsible for our medical, so the app is a medical device, and we have the same liabilities, and we need to really specify which responsibilities we take on. So we would try not to take too much, but we take it quite seriously as well.
Well, and then let's try to, we have the last 5 minutes. So I would like to invite you to see how you see this same conference in 10 years about this question, about the patient journey. How will be that in 10 years? How do you see that? Your future perfect. How do you see? No, start yourself.
So I think nowadays it's mostly going to be driven. Today it's mostly driven by pharma companies. In my view, I think more and more with DTX, it will be more and more public, but also private insurance. And I think by 2030, it will be mostly driven by insurance and looking at prevention much more effectively than we can today.
Stefano?
As I said at the beginning, and in the same way, in my opinion, in 10 years we will speak much more about users and not patients, because I think that the e-health part will be much more, as you said before, to prevention and to try to have a much more healthier, let me say, society, and less on the, let me say, on take care, no, in case of. So essentially, I don't know which will be the key players on this, because there are all the industry. For me, will be another company that will be like, I don't say a joint venture, but a consolidation of all the different, let me say, key strengths of each one of the industries that are working right now on this.
Well, it was Eva's idea, this consortium of companies. So how do you see that?
Yes. Well, for me, we will not speak about e-health, digital health. We will just speak about health. That's one point. I feel that it is going to be, patient or the person or citizen in the driver's seat, and I hope that the journey is seamless. That we have much more empowered patients that actually then understand the treatment that it's being given to them, because health literacy and the understanding today, it's still a huge thing. So we can have, I don't know how many digital devices and so on. If a person doesn't know and understand how to use them, it's just going to go down the drain. It's not going to be helpful. So for me, I see like a seamless, patient-driven, citizen-driven journey.
Teresa?
And I will just add, because I follow your ideas, to me it will be a persona-driven health, not a patient-driven health. Because personas, people will be seeking for keeping healthy. And people won't be seeking for treatments, So they will be demanding, and in case of disease, they will demand a treatment that is compatible with their daily lives, that is personalized, digitalized, where they make decisions. They are part of the process, the decision-making process, and we'll also see, if this happens, we'll see a shift in the healthcare budget. We'll see how some pools shrink, because these pools are not needed anymore, and other new pools we can't imagine today will appear to meet these new personas' needs.
Okay, well, they have a similar perspective from different sides, but it looks more or less the same. I hope to be here to invite you in 10 years, to invite you to beers, to celebrate that things have happened. So thank you very much for your time and sharing with everybody, and let's give pass to the next panel. Thank you.
Thank you.
Thank you.
Wait 1 second.
Okay.
That's great. Well, thank you very much. Thank you all. Thank you, Frederick, for this fantastic panel. Now it's time to go ahead with the third show and tell, the last one on today's event. So we will have 4 companies. Remember, 4 minutes of glory for your demonstrations in terms of digital health. And well, let me introduce you the first show and tell, and will be from Medify. Johannes Moich is a manager operational excellence at Medify, a company that produces software to clarify healthcare for both patients and healthcare professionals. Johannes will present the MEX and the dashboard solutions created to educate the patients in a visual way and integrate them in the hospital's work processes. So, here I have you. Johannes, thanks for your time. The stage is yours, and remember, here is your countdown, right?
Perfect.
Thank you.
Thank you very much.
Thank you. Yep, it is.
video of an orthopedic surgeon that illustrates a typical situation when he explains the upcoming procedure of the patient. The video I will show is a funny, comic video, but in fact illustrates a problem that has been existing in healthcare for many years. Namely, that the patient has no idea what is going to happen during the surgery, what can lead, therefore, to anxiety. Please put on the movie. The movie, yeah, there's the movie. Okay. Again?
Hi.
Yes, this is it. The good news is that we have a solution for this problem. At Medify, we are specialists in visual explanation of medical-related information. Our main focus areas are patient education, shared decision-making, research, and e-learning. So how does our service work once implemented in a hospital? Movie, keep. Okay. So how does our service work once implemented in a hospital? As a hospital staff member, I log into a dashboard from where I can monitor all the invitation I've sent out to the patients. And as well, I can create a new link from here. I fill in the patient's ID and email. I select the procedure, and the patient receives an email. In this case, is a bronchoscopy. I click on send, and what happens then is that the patient receives an email with an explanation of the digital intake, and they click on the link to open it. They will now see the entire stepwise explanation of their procedure. So really, from the preparation at home until they leave the hospital again. I will show an example of a video here. As you will certainly hear, the video contains a voiceover. Here, the device that is being used during the procedure is being explained.
The tube with which we will perform the examination is called an endoscope. It is first thoroughly cleaned and kept in a special clean cupboard. The clean endoscope is fed into a box.
In the core of each application, we have a 3D visualization that explains the procedure itself. As you can see here, the pulmonologist is inspecting the bronchi. And then, in the end of the application, we have a questionnaire that collects medical information and informed consent of the patient. In this case, the patient actually can sign their approval for the upcoming procedure, because they're better aware of what the procedure is, what the risk and complications are, what happens after their procedure. The questionnaires can be also used for prompts and prams after the procedure, or ask questions to measure the learning curve in case of e-learning or research. When a patient has clicked on the send button at the end of the questionnaire, it will become visible on the dashboard again. And in here, I can already see on which aspects of the patient's health I have to pay attention, because they're indicated in red and orange. Normal health aspects are displayed in green. Yes. So, this is an individual response, but I can also see reports of an entire patient population. I've showed our service in its standalone format in our dashboard. The whole invitation and questionnaire response part can also be fully integrated in the hospital systems using Health Level 7 integrations. An example of the research and e-learning functionality of our platform is this clinical study that found that patient education via our Max results has the same quality of bowel preparation compared to traditional nurse education. Finally, we also make e-learnings for the industry. For example, to teach hospital staff about the new device that they're going to use. At Medify, a multi-skilled and multinational team is looking very much forward to collaborate with you. If you have any questions or are interested, please come visit us at booth number 19. Thank you for your attention.
Medify, let's move to citizen communications. Let me introduce you, Mr. Alan McKay. He's the Managing Director of Citizen Communication. And Alan is here to show what the UK's NHS is achieving in positively influencing patient behavior with data-driven personalized video communication. So, good afternoon. The floor is yours, Alan.
Thank you very much indeed for your time. I'm going to talk about data-driven personalized video. It's occurred to me actually in this last just hearing this last presentation that actually what we've got here is something that enables patients to navigate the new world of healthcare. That's one of the things that everybody is going to need to address. The world in which we operate in is changing dramatically. And what we have here with our personalized video product is the ability to use the video medium to communicate en masse at scale, but personally, using data and information that is specific and relevant to the individual in a video form. So whether that information is test results, whether that's about signposting people to services that are available in their community, or whether that's just about connecting with people on a human basis by giving them the reassurance that people just like them are doing okay, they're doing well out of the services that are being provided. This is where personalized video has a role to play, helping people to become much more active participants in their own health and well-being. We are already working on projects which are covering areas such as disease prevention, chronic disease management, mental health, well-being and support, and promoting and signposting people to digital services. This is not new technology. This is becoming already a part of the communications armory of major brands and organizations, both here in the UK, here in Spain rather, and in the United Kingdom, all of whom are using this technology to do most of the things that health systems need to do in a post-COVID world. We are already working within the UK's National Health Service, and if any of you know anything about the NHS, you'll know that that is a real achievement in its own right. I had hair before I started working with the NHS. And as you can see, what we're seeing from that is that this is proving to be a highly effective way of positively influencing patient behavior. We achieve exceptionally high rates of engagement, which leads to measurable behavior change. And, as I'll show you in a moment, we're doing that across all sections of the population. In this last year alone, about 100,000 patients have received one of our videos. We're supporting diabetes prevention, we're supporting diabetes, type 2 diabetes care and self-management, and we've been supporting people living with a range of long-term conditions during COVID. NHS England themselves have analysed our data and have confirmed that we are achieving significant behaviour change. Just one of the figures on this chart here indicates patients are 4 times more likely to attend care interventions having watched a personalised video as compared to the control group who didn't receive videos. And as I've already said, we're doing this across all sections of the population. It is interesting to note in the middle there, in terms of age, people aged 75 plus at the far right-hand end of this chart are interacting with this content and responding to the content in precisely the same degree as people aged 18 to 29. So what we've got is something that is highly relevant. It maintains that human connection between patient and care provider. It nudges people to act, for those of you that are into the behavioral science of all of this. It gives people time to process information so that they can become much more active participants in their health and well-being. And we've got loads more to share with you. We're downstairs. Please come along and say hello. Thank you very much.
Thank you very much, Alan. Please, here. Well, third round of the show and tell, third company right now. So let's carry on with Nixie for Children. I want to introduce you Claudia Gustems, who is Head of Partnerships at Nixie for Children. What's Nixie for Children? It's a startup focused on helping children prepare for difficult procedures and reducing anxiety before visiting the hospital through virtual reality experiences. So, Claudia, the stage is yours. Here's your countdown. Whenever you want.
Thank you. Hi, good afternoon. I would like to start by introducing to you Julian. Julian is a 10-year-old kid. He was our very first patient, and he was about to go under surgery, but he was really nervous, he was really anxious, and he would have stopped crying only because his older brother had a really bad experience, so that was his only reference. The problem here would be that 500,000 kids go through surgery every year in Spain, which means that 60% of these kids would go through preoperative anxiety, which translates to more anxiolytics intake, longer recovery time, and regressions on the behavioral side. That also will cause traumatic experiences and a change on the perception of pain. So our approach to that would be to create a tool, that's an exposure tool that has an easy implementation, which means that the kid would be autonomous, that is clinically validated and treats family as a unit. Not only the patient, but also his surroundings, the doctors and the patient and the family. Okay, so there. I would start by introducing myself. My name is Claudia. I'm Head of Partnerships at Nixie for Children, and today I'm going to explain to you how that works.
Esta es la sala donde haremos las fotos especiales que nos dejan ver dentro de ti. Para hacer eso, hay que quedarse muy quietos. Y para ayudarnos a que no nos movamos, María hinchará un colchón que cogerá nuestra forma.
This is a part of the radiotherapy experience that the kids see through these goggles, these VR goggles that they're given before surgery that they can play with and use to get to know better what they're going to go through. And these are some of the use cases. We are mainly based on surgery for all kids that are going to go under surgery, and then radiotherapy, as you just saw. We're partnering up with some foundations to develop these kind of experiences. And we also developed hemophilia. We're about to launch it. And we're also trying to investigate a little bit the environment on where adults could use VR as well in cardiac surgery in this case. This is the Nixie kit. That's what they're given. That's what they will play with. That's what they be using to get to know what they're going to go through. Mainly the goggles that I just showed you. Then the mini Nixie, as you can see here. And they will also have access to a virtual platform where they can get to have more information about the surgery and the procedures that they're going to leave. Again, what I said, the information that they will find also links to more content and extended content and frequently asked questions that can be useful for the family. As I mentioned before, that's something that we designed for family, patients, and the doctors. Also, that knowledge on families helps the doctors get to know better and open channel communications with the families. This is the panel that the hospital has. They can keep track of how many times the kid has used this Nixie kit, how many times they've seen it, how useful it was, and how much time they've spent on it. So this is the Nixie family. Today with me, I have Tomás, the CEO and founder of Nixie for Children. Of course, Nixie, he's the one doing the heavy lifting. We're just helping him. And we're really glad to be here and explain to you our project. We are looking forward to meet you and help you with all the questions that you have. We encourage you to come visit us in booth number 11. And for those who are online, you can just contact us on LinkedIn, and we'll be happy to answer your questions. Thank you.
Yes. Thank you, Claudia. Nice presentation. And let's go ahead with the last show and tell. And it will be from SMTP and Josep Rodiera. Hello, good afternoon. He's the CEO of SMTP, a company ready to offer a seamless, all-based digital solution to hospitals and professionals that will ensure a more robust, safe, and patient-oriented solution for perioperative processes. So, good afternoon, Josep. Thanks for your time. And the floor is yours.
Thank you very much. I am Josep Rodiera, CEO of Smart MedTech.
I am also an anesthesiologist, and I have a Master of Bioengineering. SmartMedTech is a company who develops digital solutions to help professionals, especially nurses and doctors, to follow the guidelines in the context of the surgical process. I'm sorry. Surgical process represents between the 60 to 80% of the total cost of the hospitals in Europe and the United States. And in the other hand, the deviations of the clinical guidelines is the most important factor in the prolonged stays of the hospitals and surgical complications. This has a very high impact in the health of the patients and in the cost of the healthcare. Digitalization powered by artificial intelligence can customize patient perioperative journey while improving its wellness, easy practitioners' works, and create a safer environment. Our solution is based on artificial intelligence data processing, which with advanced analytics processing, who allow professionals, nurses, and doctors to lead the perioperative process following the guidelines and for the patients to live a patient experience tailored patient journey. Our platform is interoperable, is modular, and could interconnect the different parts of the surgical process and the different professionals involved in them. The platform range from the preoperative assessment to the postoperative care. In the perioperative assessment, where we are detecting and evaluating the risk and the assessment of the patients, we detect and evaluate the complexity of the surgery, and especially we prepare the patients from facing the surgical procedure. During the intraoperative process, we have to customize the plans to ensure that the efficiency of the process, helping the professionals to do the things better. Also, in the postoperative care, we should to take care about the pain of the patients and monitoring the evolution of the patients. In Europe, there are more than 30 million years of surgical procedures. The following of the guidelines has an impact, direct impact in the results of the healthcare, and has a clear benefits on patients and on professionals, surgeons, anesthesiologists, nurses, the rest of the staff. We have a team very well balanced, with there are doctors, nurses, engineers, there are science, data science, and physics, who are working together to get applications to help professionals to do the things better. Thank you very much. We are working for professionals and patients, and we can attend you in our booth in downstairs. Thank you.
Thank you, Josep. Well, that was the last one. We had an amazing show and tell session during all the day, don't you think? And now it's time for networking, as all our companies said here before on the stage. So networking online through the app, but also downstairs on the physical booth. Take a rest, grab a coffee, and see you at 5 p.m. Spanish time for the last panel of the day. Thank you. See you later.
¿Sí? Hola. Sí, vale. Dale.
Well, welcome back. Welcome back to all of you. I hope you enjoy your coffee break. I hope you've been doing networking, of course, downstairs, but as well through the app. Did you use it? Sure. Great. And remember, we had all the physical booth downstairs. I hope you've been visiting it. And we also have the virtual ones available for you to visit through the app. So let's move ahead with the last panel of the day. We will talk about data. Remember that all of you here physically, but all of you that are following us online, you can put your questions by using the chat next to the streaming video in the platform or the app whenever you want. And then we can pick them up during the panel. Okay. I will leave the floor right now to Cristina Vescos. She's the Managing Director of EIT Health Spain. And okay, she will manage this panel. So Cristina, the floor is yours. Thank you.
Okay, thanks. Thanks the organization for inviting me also to chair this amazing panel. I think it was very intelligent of the organization to put the best panel at the end. So we hope that you will enjoy all. I mean, the previous one was excellent, but this one is going to be surely better. So as said before, so my name is Cristina Vescos. I'm the director of EIT Health in Spain. For those who don't know what this is the European Institute of Technology and Innovation, and I mean, our purpose really is to accelerate the innovations made in Europe and bring them to the market and to the patients, as is the motto of today, as soon as possible. So I have the pleasure to chair this amazing panel. So let me just first introduce all the panelists. So one by one, I think we will follow a bit the picture, if you all agree. So first in the picture is Jordi Piera. Please welcome to the floor. Jordi, I mean, I know him from a long trajectory, especially in integrated care and digital health in Europe. His background in computer science and health economy, and now the director of the digital health strategy of the Catalan Ministry of Health. So please join us. Thank you. Then second person we have here is Paul Burggraff, if I pronounce it correctly, so CEO of Thrive, and also coming from Germany. So I think it's very interesting that we have people from Berlin also here at the hub and joining also the experience with COVID and German data. I need to check a bit on your experience at Zurich University also, and mainly background in let's say engineering and economics too. So thank you joining us here for the panel. Third one, I'll just follow here, Javier de la Oca, CEO of IOMED. It will bring us a bit of the business side of the digital health. And we'll hear also about what IOMED is really doing in what is access to data and what we can use of it. So thank you for joining, Javier. And the last one, but not least, is Emma Albacar. So it's now European Data Management Director of Veristat with a very, very long trajectory in CRO. And we'll talk about also clinical research and how data is changing that floor. So thank you, please join us. And I think it's also nice to have different backgrounds and also a very varied panel. So we'll talk about data. We will assume we have data. I mean, I think that's not the question, I think, in 2021, but what we do with the data. No? I'll give the floor first, if you want, to Paul, because I think it's important that we learn about the experience, what Thrive and Germany has done with the experience of COVID. And so please, let's start with that.
Yeah. Thanks a lot. So I'm the co-founder and the CEO of Thrive. And I will start with a story, basically, that happened last year at the very end of February. And back then, it was in the news that there might be a new virus entering the world. We didn't know whether it would be dangerous, would not be dangerous. And so the epidemiologists in Germany asked themselves the question, where can we get the data to actually find out more about the virus and maybe the spread of the virus? And back then, already we had the lab infrastructure, we had very early on the PCR tests to find out, but the main technology that linked the German Center of Disease Control to all the labs and the local health authorities is a technology, but that technology is the telefax. That's the dominating technology in Germany to link that. And so there was a big fear that there might be a too long chain. So whenever a new outbreak happens, it takes a while until the lab results are there. It also takes a while until people actually know that they might have symptoms and they go to the lab. That all adds up. And then it takes even more, and there's many problems in using the telefax technology in an outbreak of an epidemic. So the main question was, what alternative sources of data do we have? And when we talk about digital health, we talk a lot about the new data sources. Yes, we will have electronic health records. Yes, we will have a lot of hospital data, and we develop more and more interfaces. But in Germany, it was not ready. And it's going quite slow. So there was one other idea, and that is that patients already measure their health very frequently. Most of us, we use smartphones. And every smartphone, they have, for example, some information about your geolocation. If we have the geolocation, we also have the information about the weather at this place. We have your step count, that we can see how often you move around different places. And as an epidemic is also a social phenomenon, that's important data. But even more important than that, in Germany, more than 20% of the people already use smartwatches and fitness trackers. And those devices, they measure not only the steps during the day, but also the sleep. And they also measure, in many occasions, the resting heart rate throughout the night. Many devices measure that 1,440 times per day. So there's an enormous amount of data that is already generated by the patient. And we proposed, let's use the data, because there's quite some evidence that infectious diseases leave a certain pattern in those data streams. And so we sat together with the epidemiologists and discussed whether this might be of use to shorten the time from a spread of the virus in a certain area and the time that the German Center of Disease Control has the first knowledge that something is changing. And so it was in early March last year that we sat together and did the first drawings about how that could be. And it was in early April that we launched in Germany the data donation app. This is a citizen science project, so there's no compensation for the participants. There's no money, they don't even see the results of the digital COVID tests that we perform them. They just said that I want to help the government to have a better picture of the situation. We want to support the researchers. And that was the only motivation for we kind of underestimated the response. We thought that might be a couple of thousand that might contribute, but within 4 hours, there was more than 400,000 people connecting with that app. And back then, the Google Play Store broke down because the app was not known before and could not be found. Google Fit broke down because there was too much data drawn from it. The website broke down. Many things went wrong. But we were able to recover all the data in a couple of days. And from that moment on, we were able to look for the patterns. And when we say that, what does data tell us? There's two aspects of the story. The one aspect is that the data is already out there. Many patients, they buy smart devices. They buy smartphones, they buy wearables. And in those devices, they already, because they like it, and they like the service, and they like the experience, they already measure what we need in many occasions. And this is a very nice start. And the second aspect is that this data, albeit recorded by patients, and they can make many mistakes. They can put the variable in the wrong way. They might forget it in a certain night. So it's different in the quality from what we record in a hospital. But also, this data is very, very rich. We have a very high frequency of measurements, and we have a lot of patients. And there's a very specific pattern in terms of respiratory infections, and that is when a patient gets infected, contrary to what we might think, the resting heart rate drops, But then after only a day or two, it rises very sharply on a super high level. And especially when people have, for example, fever, 1 degree of fever equals to 8.5 beats per minute more of heart rate. And that's pretty constant in young people, old people, sick people, healthy people. It's a very, very solid, robust mechanism because the body needs the energy to heat the body. And so the heart needs to produce more or to supply more oxygen to the muscles to heat the body. So we see then when the symptoms start setting in and the body starts to fight against the virus, that the resting heart rate goes up. And it stays there. It stays there for a long time. At the same time, for example, the step count drops. People don't move. They feel sick. They don't want to go out. They feel bad. They don't walk around. Even if some people don't walk around on a rainy day, but then the next day they start walking again. And when they have strong symptoms, they don't do that anymore. And we don't need to ask the patients. The data is already there. And also the sleep changes. People sleep longer because they want to recover. And this is a very, very distinctive pattern that we can see. And in the end, there were more than 540,000 people that connected their wearable device in this program, in this data donation app, without having any benefit than the idea of helping others to understand the epidemic. And the nice story that we get from this project is that the data is already there. Patients like to record it. And if we put the patients first, the passive sensing, I guess, is one of the main elements that can enable us to basically move healthcare more outside of the hospital.
Thank you, Paul. I mean, what you really highlight is the importance of all kind of data. Now, we were used to very structured medical data, and suddenly we are more and more aware that there are other data that can be even more relevant than what is the structural clinical symptoms. So it's really the data that we have linked to the health outcomes. How can we make use of all the data that we have? No? That's a bit the question. I want to, maybe, Jordi, if you want to start with that part, and we'll continue.
Yeah, well, that's a very good question and a complex one. I mean, here we have in Catalonia a very long tradition of sharing health-related information, the one that you collect at healthcare facilities. Since year 2007, we've been sharing medical records all across the public sector through interoperability. And all this information is accessible by all providers within the public sector. We have, well, the platform is called the Shared Electronic Health Record of Catalonia. In there we have discharge reports, we have laboratory results, X-ray imaging, all that sort of thing, summaries basically of the information. We have it in there. We started with non-structured information back in year 2007, and step by step, by taking advantage of the bilateral contractual relationship that the Catalan NHS, so to say, has with every other provider, we force them to keep moving towards more structured information. The problem that we have, and I guess it's everywhere else the same, is that the main data source, health-related data sources, I would say, are the medical records. And all of those are storing the information in different proprietary formats. Here in Catalonia, only we have in specialized care 29 different vendors, each of them with their own data model. And well, it's very costly for us to maintain gathering this information. We built on interoperability, and it's been, well, I mean, we are very happy or pretty happy with it, and it has helped a lot the continuity of care. We think that this approach, it's not the one that we should be following. We think that data is buried in plenty of different silos of information, being the medical record the biggest one, but in a hospital, and a very big hospital, tertiary hospital, according to our calculations, there are between 800 and 1,000 different silos of patient-related information. So we say that data is not following the patient because it's very difficult for us to gather all these silos into a single one. And once we want to take systematic advantage of all this data that is in there, we're mentioning that data is there, but yeah, well, we spend 80% of the time in a project similar to the one that Paul has been explaining, cleaning the data and making some rationale out of it. That's even more complicated once we gather real-world data. He was explaining. So really here the challenge is trying to find a common language for these data models, for these clinical data models that we want to exchange and take advantage of. Because the usage of this data set should be not just for one time or for one algorithm or for one physician consultation. I mean, we should be able to process these data sets hundreds, thousands of times. I mean, they should be available in there for life, not just for since before you are born until you die, but then for your successors. Or it should be there, and we should try to homogenize this. We have a proposal to do so, and maybe you have heard of it. It's not us only the ones that are moving towards this. We want to standardize these clinical data models following a standard, an open standard that has been in there for many years, that some regions or places in the world have already adopted. We have the experience of this, I don't know, the city of Moscow. We have the guys in Karolinska. From the 5 vendors of EMRs in the Nordic countries, 4 of them implement this standard, and it's called OpenER, Open Electronic Health Record. And we think that with this, we will be really able to unlock all this power of data, be able to really link real-world data with health outcomes, and also unlock the door for innovation, because right now, all these startups, and that's a good place to speak about them, that are trying to go into a hospital and sell their technology, they need to agree every time on a different integration with the system, because basically the data inputs or the data sources are different. Of course, we have a lot of people against us, the ones that have, or the big vendors of EMRs, because of course they have their proprietary models and they don't want to change them. But, well, we truly think that that's the way to move forwards, and we are building our new EHR on that. And I think that this will be what will be really able to, well, allow us to really link health outcomes and have better health results for patients.
Yeah. So you mentioned Open EHR. I think the first time I heard about it, I was living in the Netherlands. I don't know exactly which year, but I left the Netherlands in 2006, so that was a long time ago. But it's true that it has taken so long really to go through that process in the mindset of administration and the official data keepers. No? But I think, as Paul was saying, we need a different level of speed now. We need agility, and I think I'm going to give the word now to Javier to see what can companies like IOMED help in this idea of I mean, we have certain data. We need to be able to access different structures, different kind of data, and we have to do it not in 20 years, but really now. So.
Precisely, and thanks for that. I'm very glad that Jordi was introducing the problem of standardizing data and the different data sources and how that format actually hurts innovation and hurts the process of generating new solutions for patients. That's a very important or a very big problem for hospitals. Obviously, where someone has a problem, we always see an opportunity, and that's exactly where we are working at. So. We see exactly the same problem that Jordi was describing, but what we're trying to do here is expanding the reach of the solution beyond, let's say, beyond the connection or beyond the interoperability of all the data, and merging into what we call the unstructured side of data. And that is important because, as Jordi was very correctly mentioning, most of the information is collected in EHRs, in electronic health records, within hospitals. And even within those systems, even in very advanced ones, we still have a very important part that is unstructured, which means it's stored in a text format. There's very little that we can do with that in terms of purely analytics and using that information for actually doing something meaningful. It's text that we can just read through, or we can consume it, but we cannot use it for proper analytics. And I'm thinking about innovation, I'm thinking about research, I'm thinking about studies, trials. Probably we'll hear about clinical trials in a moment. I'm thinking about helping on patient diagnosis, identifying, helping identify patients with rare diseases, and so on. So I'm thinking really about a lot of potential uses, and at the beginning we were discussing on potential uses for the data. There's a lot to be done, but we need the data. Now we have a lot of that, but most of it is still unstructured. Now our approach to that is connecting to hospitals like Jordi was describing, but in our case, focusing on the text, so focusing on the unstructured bit of the electronic health records, and transforming it into structured information that follows standards again. So follows standard ontologies, standard data models. In our case, we're using also OMOP as a data model. We're using ontologies such as SNOMED, ICD-10. So we're using really internationally recognized standards. The idea at the end of the day is overcoming barriers such as how clinicians write in a given hospitals, what language they use. It's a very good place to speak about that. Do they speak in Catalan? Do they write in Catalan? Do they write in Spanish? Do we want to go to Germany and write in German? Now we want to overcome those barriers. We think that data needs to be way more universal than that. If you want to conduct a clinical trial and you want to involve patients from Germany, Spain, and Portugal, you will need to be able to use data that's been originally produced in Portuguese, Spanish, and German. Now we need to overcome that barrier. And the only way to do that is applying layers that process that information. And those layers, or the ones at least that we are introducing into the market, or we've been introducing into the market since 2017, is based on natural language processing, a technique that allows us to read, not us, but obviously our systems, to read into thousands and millions of medical records very quickly, and produce a data set that's completely usable, standard, that can be then used to action certain uses. And then about speed. Speed is crucial here. And speed is also very rare in health. It's very, very rare. Anyway, the moment we have standard information that is able to cross borders, that is able to break the barriers of language, that is able to break the silos within hospitals and outside of hospitals, that moment we've overcome a massive issue when using information. So that's critical to speed up innovation, to speed up research. And in this field, we're really glad to have really interesting results with key partners in different industries, obviously in the healthcare industry with several hospitals here in Catalonia and the rest of Spain, also abroad. Partners in the pharmaceutical industry, I see several of them I've seen them today here in the event. So we are really glad to start seeing the outcomes of this standardization in clinical research, in patient identification, and clinical trials, and so on. So things are moving on, things are happening, but we really need to break those barriers related to data in order to really make breakthroughs in that sense.
So thank you, Javier. I think, as Paul has said, I think patients or citizens are much more prepared really to donate now data and to collaborate with research, and we'll talk just now one moment with Emma about also clinical research and how, this data that patients are producing and citizens are producing and are willing to share, how we can really use them for clinical research, clinical trials, with your experiences here.
Yeah, indeed. So here we have a huge potentiality on using this kind of data. First of all, as you said, Jordi and Javier, we need to structure the data, make sure that everything is the right standard, because there is a lot of interaction that can be done between the industry and the healthcare and health outcomes. So in order to make possible all these all this information that needs to be used for the clinical trials, I think it's critical to this. But I would like to add something into equation. It's also not only about the standards, but also we need regulations in place in order to make this happen, because now legal contracts, all the authorities need to be aligned with that in order to facilitate that. So agree also on the speed. Is now the moment. So I remember during COVID, now that Paul has also shared your experience during COVID, we were facing some challenges in order to collect data, proper data, in those obscure times during the hard pandemic in April, to get the right data to try to find not only a vaccine but also a possible treatment for the more severe patients. And it was challenging because the system seems not to be in place, and the data was not in place. It was quite challenging to get there. So I think if we establish the basis and we all together work, the public health, private industry, and all the organizations dedicated to the clinical research, we work together, we can achieve that and be faster on that movement. Because the future, I think, I foresee the future of the clinical trials, not only using this data for real-world evidence, late-phase studies, but also imagine the potentiality of using the existing data for clinical trials, so we allow patients to invest less time on the visits, physicians as well, investing less time on collecting data, because this data could be already clean and ready to be used.
So we have heard now kind of the 4 positions, 4 challenges and possible solutions. We know, patients are willing to donate the data. We need the data for any startup, any entrepreneurs needs to provide clinical evidence of their solution. How we facilitate that? The European Union is really advocating for data lakes. It's also part of the 18 component of the national, in Spain, the National Resilient Plan. Are data lakes the solution? I'm just going to throw it to the panel. You can start a more open discussion as you wish for.
Well, certainly, the use of data in this sense has to go through a certain or through some data lake similar solutions. We certainly need that. It's important to highlight that we need to preserve certain rules when establishing these data lakes, data warehouses, and so on. So it's not just about data standards and so on, but we need to preserve rules that guarantee patient data privacy. That's essential. That's basically the first thing we need to guarantee. But we also need to guarantee other things, such as who governs the data that's within that data lake. Who governs that? Who is the owner? Who's responsible for that data? Who answers when there is a breach? And all these steps need to be defined when speaking about data, about the concept of data lakes, which is obviously very, very wide. And there is a lot of different approaches that we can follow when onboarding the concept of data lakes. But in any case, we need to guarantee that certain levels of basic guarantees for patients and data owners is guaranteed in this sense. In our case, we work a lot with federated models that allow us to produce data lakes, let's say, in a combined and federated approach. This allows us to be able to reach a very wide amount of information without renouncing on the governance that has to be transferred, in our case, to our data partners, in this case, hospitals. So they will be always governing their own data, but the federated approach allows us to swiftly collect information from all those different data lakes that are, let's say, under the control of hospitals. And in this sense, it's an approach that allows us to guarantee governance, privacy, security to our partners. And it's a very important milestone, let's say, a very important cornerstone of our offering.
I'm going to be a bit provocative here. Of course, we have to protect the privacy of data. That is, I think, that is assumed as one of the rights of citizens in Europe, at least. But Aaron, we utilizing the patient and this protection just not to advance too often. Can we? as you say, I mean, the technology probably is there since a couple of years. I mean, and we are still discussing this topic even in the time that we have realized with COVID that we need to be faster. So just provocative question, is really the problem, the challenge, the data privacy, or we are using it as an excuse not to confront with the real need that we need to change how we store the data in order to facilitate that access for entrepreneurs, for innovation?
I guess data privacy is a prerequisite. Like, people need to have trust, and data privacy needs to be a balance between what is needed to ensure the patient's health and to improve the healthcare system and the privacy needs. And I guess there's also the concept that people can choose different levels of data protection. I don't believe in the data lake. I don't believe that there should be one central storage, but I believe that there should be always the technology to make data flow, and it's more about the interfaces. So, for example, when a patient onboards a specific program, let's say after a knee surgery, and the data that is maybe 1 year old about the activity and the agility of the patient would be needed, it would be nice that the patient could at that moment say, you can use my data from 2 years earlier, and you can have it in all the details, and somebody that doesn't have a knee surgery doesn't need to supply it to this specific partner. So I believe it should be very flexible. The patient should be able to customize the data needs, but we should make sure that all the different data silos have interfaces so that they can easily connect it when needed.
Yeah, so I mean, this is probably not so much about the rights, but having the right tools to access the data, no? That's okay. I don't know, Jordi, if you want
I mean, I think that, yeah, that the part of privacy, I mean, it's a requisite for us, as Paul was saying. I think that this is a must here in Europe, and it's what distinguishes us from the Chinese or from the Americans. And of course, they will advance faster than we do. I mean, for them and I mean, if you see what the Chinese are doing with the data of the population, they say that it's a public good and they are using it as such, and they are taking massive advantage of it. But well, I think that there's our nature. We cannot change it, and I think it's truly stopping us a bit. But well, I feel safe in that environment, other than other approaches that we see around the world. That's my point with that.
Yeah, I mean, we have to ensure definitely the European values in whatever innovation is developed here, but it's also in what is in the end adopted here. No, if we are probably too late in the development, we will adopt technologies that are not following this value anyway. So, so it's a bit.
The idea that Javier brought into the table about the federation of data lakes, or the federated learning environments, which is all these different lakes of information that follow a normalized data structure, that, well, you contribute into the big community with your data, but your data does not flow from there, just stays at your place, and you decide which algorithms you plug in them. I mean, it's basically used in AI, natural language processing, and all this predictive modeling, all these different techniques, and you contribute with your data set, but your data set does not fly outside of your boundaries, so to say. I think that that's a very smart approach that many projects in Europe we are seeing that are adopting such an approach, and allows well, people such as Javier and his company to just be able to test the performance of their algorithms, and then all the contributors of data to take advantage of this. And with this, you preserve, I mean, the privacy and everything. So I think that we may have found a solution. So the European health data space should be some very big repository, as Paul was saying that he's against. I think that we, all of us, are against this, and that's not feasible at all. But federations with normalized data that we can use to take advantage of this, I think that that's the solution that will help us overcome overcome the barriers of privacy, and at the same time remain being Europeans.
It's the balance between the possibility of using large sets of data without losing the control of your data. So it's kind of the mix, the perfect mix in that sense. It allows you to balance governance with use. And in that sense, it kind of solves this sort of conundrum.
So you bring the algorithms to the data and not to the data to the algorithms, so that this is the key part. I wanted to ask you also, Emma, in this sense, do we have the tools really that facilitate that process also in the secondary use of data? No? So we know we collect a lot of data for clinical purpose, but I mean, it's really adequate the tools for research so that we don't take so much resources and so long to the next drug development or the next medical product.
So I think clinical industry is ready for taking this kind of data, so our systems are prepared. And I would like to the point about data privacy, that it's not only, well, I completely agree that this is a very smart solution, but also technology and vendors bringing that technology on the market has already put in place some measures for guaranteeing these rights for the patients. So in fact, companies working globally, worldwide, they are taking that under consideration. Otherwise, they are losing market in Europe. And so the tools are there. So it's about to request that and put in place. And then in terms of collecting data and connecting data, clinical trials and the industry are ready for that. So it's just about, to make that kind of connection. So I think there is we are starting having experience on late phase trials to capture this data and to start doing, trials with this kind of data. But I really think that we, industry CROs, need to make the extra step and go further and try a clinical trial collecting these existing data. We are ready technologically, so it could be possible.
Yeah. So this is a call for industry to take the risk. Huh?
Indeed.
Okay. Let's see.
I would like to say something on this.
Yeah.
I mean, historically, clinical trials have been one of these sources of patient-related information silo creation. I don't know if that's something. I mean, it was very typical when you were hanging around the hospital, this certain physician being part of a clinical trial and having all the data to be collected in the context of the trial in an Excel sheet, in an Access database. Later on, this advanced a bit, and then they started collecting them centrally because the quality was awful, of course. This moved into these platforms, RedCap, whatsoever platform that now CROs and all these big trial management companies are using to just try to standardize the way you collect this data. Well, right now, I mean, this is still creating silos because this is still patient-related information that should be part of their medical record, so it should follow the patient, this data. And right now, because it was, I don't know, the symptoms, whatever, in a specific moment of this person's life. And it's interesting for the healthcare system to have it because, well, not for the healthcare system, for the patient, for this data to follow him or her. That's one thing. The second one that I wanted to say on this is that, well, of course, and I'm very happy with this, and Javier went into that before. Pharma companies, I think that they, as the main source of clinical trials, they have realized about this, and they are pushing very strong a standard, which is the OMOP standard. They have given a lot of money to plenty of fancy researchers all over Europe, the US, Australia, everywhere. And, well, it's really taking over for observational studies, and it's trying at the end to do the same, normalize this data, because they found out that it was not, well, the data that we were collecting, it had not enough quality, blah, blah, blah. I agree with this, and I am very happy that we are reaching an agreement with this in this layer for prospective observational studies in the context of clinical trials, but we need this data somehow to make it follow the patient and flow back into the healthcare system.
Well, if there is a way of using these standards, which is basically what we're trying to bring to the market, of using that standard, those standards, to to allow a flow directly from the health record into the different softwares of CRF, etc., that are used in the clinical trials. That allows you to keep the data produced in a clinical trial within the boundaries of the hospital, and still it allows us to collect it for a clinical trial without a double data introduction by the professional. And that's precisely what it is about. So if we can standardize information within the hospitals, and we can do it with all the information, not just, let's say, the coded information from the hospital, also the unstructured part of the text, we can standardize all of that, and we can agree on a data standard such as OMOP. We can then link that through basically data extractions with the CRFs that are being used in the context of clinical trials, and therefore we are allowing researchers to collect the information without taking it out of the hospital, and also without, let's say, losing it in the context of the trial. And therefore we are again breaking the barriers of the silos that are let's say, annoying in this sense.
So Javier, you mentioned, go ahead.
No, I would like to add to that piece that, in fact, eCRFs are collecting the existing data in the clinical history, in the medical records of the patient. Clinical trials are also adding extra tests to that, but in the same way that the eCRF can benefit of collecting this data, not double collect the data and clean again and invest double resourcing in that. In the same way, if we are this can be connected in two ways. So feeding eCRF and then getting back the other information that maybe is collected directly into the eCRF. So then if standards are in place, it's win-win, I think, history.
Yeah, so I think the data follows the mentality, and we're talking about two silos, so what was clinical practice and clinical research, and I think, Paul, you're bringing the double loop here, which is the real-world data, how we integrate that into the whole chain. No? You will see it happen because we need this speed, and we need to integrate, this real-world data in the clinical practice and also in the clinical research, no? As we said.
Yeah, and I believe there's also a dimension. We optimize what we measure, and if we don't measure it, we don't optimize it. And for example, in outcome research, there's 4 dimensions. There's mortality, there's morbidity, there's side effects, and what most people don't know, because our healthcare system in the last 50 years has failed to measure it correctly, is health-related quality of life. And if you ask patients, when they have to choose an intervention that they are not that sure about, what are they interested in, very often the doctor, according to the clinical guidelines, recommends and said, hey, I propose this kind of intervention, and you could expect that mortality, that morbidity, that side effects. And then the doctor stops talking. And the patients, they know, oh, there's a 4th dimension that we didn't measure in the clinical practice. In Germany, when new drugs are reimbursed, 100% of the papers the studies handed in have data on mortality and morbidity. Less than 20% have some data on health-related quality of life. And I guess our healthcare system, if we look at the life expectancy that we now have, was very good at managing mortality and morbidity. It was not very good at managing health-related quality of life because we're unable to measure it. And I guess that shows a little bit that also we should not only reinvent what we measured in the past, we should also think about what we measure. And it's not only that is in the clinic that happens, but also what happens afterwards, how it's actually affecting the patient.
Yeah, I think, this is what we just say, if you don't measure what is important, you make important what you measure, no? And I think it's really the quality of the patients, as we say. If that is important, then we have to be able to measure and integrate in our systems. I want to just ask the audience if there are questions, just please use the system and they will come to us, so we have a couple of minutes to ask also questions from the audience. So going back to this, what we measure is what we really need for our research purposes and for our clinical practice. So we measure all things.
I would say for clinical trials it is. So it's quite cost of, it's very costing to collect data for the clinical trials. So there is a protocol, and we stick to the protocol, and the costs are defined through the information that we need to collect through the protocol. So it's really clear what we need to collect in clinical trials.
Anybody?
Within the public sector and in clinical practice, similarly to the protocols, you have the clinical practice guidelines that suggest you how you should do your practice. But it's true that we could benefit from more data collection. We should be also careful, because we are asking healthcare professionals maybe too often to collect too much data, and we know that that's a reason for them to hate IT or to hate the EMRs and the digitalization in general. So, right now we have, I think, this first wave, I would say, of medical records, which are the ones that transform the paper-based medical records into digital. I think that we need to evolve those for clinicians to spend less time collecting data. That's one thing within the public sector. The second thing is that I truly think that we could benefit, and I think that Paul touched in there the true point, which is we have forgot totally about the patient-related quality of life, or now everyone calls it PROMS, and everywhere you look, there are 20 projects on PROMS, which is at the end, specifically in this context, which is the best questionnaire for health-related quality of life. And that's an interesting dimension, because in here it's where we are introducing somehow the perspectives of the patient according to this specific treatment or situation, personal situation, without using the physician as a proxy to introduce this information. So it's information that you gather directly from the patient. We are working on this, and we see projects all around emerging on this, and that's I agree with him totally that that's an area that we need to improve a lot, because it will help us purchase the best medicines, decide on the best treatments, and at the end, health technology assessment agencies should use this information to decide on which is the treatments to be funded and which are not.
Yeah, definitely. I think we have a question from the audience. So
yes,
please go ahead.
Eva Turk is my name. Thank you so much for this panel. I was actually, Jordi, you answered in a way what I wanted to bring up, because when you said, with regard to health-related quality of life, the patient-reported outcomes and patient-reported experience measures is becoming more and more important in the health technology assessment part when it comes to reimbursement of the solutions. But for me, it's also then something on how can we actually then make all of this data collection transferred into useful information, into structured information that is there for the patients, for the health professionals, and maybe I missed it as part of the panel, apologies for that. But this is the part that kind of how can we make this data actually usable for the patients and the health professionals now, and what solutions are you thinking of in that way? Thank you.
Well,
you can say you're thinking about IOMED.
Here I was telling you at the beginning that we were thinking about, or we are working on building this new electronic health record for Catalonia, which is longitudinal. It's aiming to break down all the silos of information that we have, but basically the very big silos that we have that are somehow splitting, historically have been splitting primary care from specialized care, from intermediate care, so the classical healthcare levels. The current systems that we have right now, as I was mentioning some minutes ago, respond to this first wave of digitalization, where we are basically translating the paper-based system into technology. Now, we are thinking that's not important. That's not important. Of course, it's important, but it's not the administrative process. I would say it's bringing what you are just saying, quality information to the point of care that will help the physician pick the best decisions at that moment. For this, we are thinking about, effectively implement clinical decision support tools that build on all this knowledge that we are gathering, and that now technology and people such as Javier and his company that are working on this are making this information or getting these insights available from all the data which is available. And really at the point of care, telling the physician, listen, okay, this guy, according to this multimorbidity indicator that you use, well, you have a lot of chances that it will become a huge consumer of resources, because when we compare his or her profile to the 2 million of people that have been in this situation before, they have had an exacerbation of the condition. So really, it's being able to get all these insights of data into meaningful information that is useful at the point of care. And most of the EMRs that we currently have do not do that. They may have some sort of triggers and alerts, but they truly not do this clinical decision support really effectively implemented. And we want to build on that. I don't know if we will manage, but well, there's a growing base of companies that are working in this, and that we are very keen to work with them and to bring in their solutions into the system.
And answering, and a bit also answering on the question, there is 2 layers to this. On the one hand, we need to process the information, transform it from unstructured inputs into structured information. But then there's a second layer, which is transforming that structured information into meaningful outcomes. That's tricky as well. And that's something where we need to bring a lot of expertise into. We need to focus on particular use cases. We don't want to expect, to find absolutely a solution to absolutely everything in that information. But in any case, technology is ready for that. So in the first layer, which is the one we focus in, it's about basically, transforming text into structured information. That's what we're doing through natural language processing. That's the technique for this first layer. And then on top of that information, there's a variety of use cases. Of course, we need to find those ones that are meaningful. But then there is the second layer I was mentioning, which transforms data into actual meaningful outcomes that are either translated into directly the clinical practice, let's say on behalf of the clinician, or that is somehow translated directly to the patients through whatever apps or whatever systems we have to contact them.
Yeah, thank you, Eva, for the question. I think it brought back, the good closure of the debate, because we started about what can we do with the data, and you brought back also this purpose and used by the patients and clinicians. So in the end, the data is not what is important, it's really what we do with it. So just to close, I would like to ask each one of you just a headline, if you have one sentence just to close the panel. So maybe Emma, if you want to start this.
So yeah, I would like to go to my initial message that still there is a lot to do. I think, I really truly believe that investing or working together with the public health and private institutions, we can really make the difference for the patients in terms of data quality and bringing the best for the two worlds, I would say.
Well, I'd like to highlight the positive aspect on using information, on using data in healthcare. I think there is a lot of fear still around it, obviously through privacy, and it's obviously important to keep it, but we need to highlight the positive side of using the information, of using data, and a bit, do this counterbalance on the fear of using that information. So I really think that we need to transform the speech from a speech of caution and fear around data privacy into a speech of positivity around what we can achieve through this information. So it's definitely my last remark.
Cool.
Yeah, I'd say let's dare to rethink what we measure, and the best way of rethinking is starting asking the patients, patient association, and let's start asking the healthcare professionals, because very often they're asked to measure things that we don't really, or that they think are not needed, and they are not allowed to take the time to measure what they think is needed. And the same can be heard from the patient side. So my proposal would be to kind of think outside of the classical box and ask patients and doctors, even the very simple family doctors, they have a wealth of knowledge on what they would like to measure, on what they would like to base their decisions on, and then let's try to measure that as good as possible.
Jordi, if you want to close.
I would say that we've been spending massive resources on interoperability, and this has worked very well for us, and I still think that we should do such. But I think that we should also start thinking or focusing on what I call intraoperability and deciding on a common ground of semantics to start working, rebuilding on top.
Good closure. So I think, I mean, the motto of this panel was making the most of the data to ensure best health outcomes. I think what we see is we are in a journey. We are working on it. There have been highlights and still some barriers that we have to confront. Probably is we are still talking about data is because we haven't solved everything. Normally, technology, we only talk about it when it's a problem. I mean, once you realize you have really reached that point where it's fully integrated, you don't talk about it anymore. So it's really just talking. Probably, hopefully, the next panel in the next year will be only about talking about best health outcomes, and then that will really be the meaning that we have solved these data aspects about it. So thank you very much for all the panelists. It has been really a pleasure for me also to be with you, and I hope the audience has also enjoyed the session, and I'll go back to you to close.
Thank you. Thank you to all the panelists. I would like to ask you to stay here just for a while because we will make of course, the family photo after your presentation. So, if you like to, well, stand or how would you like to, like this? I stand up here. So, if you like to come here, if you don't mind. Applause to our last panelist of the event. Thank you, Christina. I would like to ask to Christian to come to the stage with me. And a big applause to him too. The thing is, Christian, VHH Summit 3rd edition has come to its end. It was a pleasure. I hope you, all of you, and of course, for those who are following us online, I hope you enjoyed such as a dynamic and very interesting event, right?
Well, it feels like a wedding. You spend a full year talking about it, and then it happens really quick. So.
Absolutely. But for sure, all of them enjoy it, and I'm sure you have been using the app and the website for networking and so on. I'm sure you've been visiting all the booths, physical downstairs and the ones we have online. So now, time to close.
Okay.
It was a pleasure to me
thank
being
you,
with
Elena.
you.
You're really helpful, and we thank you for conducting perfectly the event. Thank you very much. An applause to Elena.
No. Thank you. Thank you.
And we hope you can join also next year. So,
of course. Part of the setup.
and you know the game, and you know that there's a lot of people behind doing hard job that you don't see them, but they work really hard to make this as it goes. I mean, well, good, fine, you feel it's easy, but it's not. There's a lot of job from the VHH team that also needs a lot of recognition, especially Aline back there, Marja, Ines, and of course, Luis, Oscar, Julia, and all the volunteers that are here today. A big applause, because, I know there is a lot of job. So thank you, because we can celebrate this because of you. And also, it's time to say also thank you to the ambassadors of VHH, to the panelists, participants. You have provided the content with your time, and we are really thank you for that. Of course, the sponsors, and we have said before, but once again, thank you for believing that we can do a good job bringing up these events, and we will persist. We'll continue with that. And the technical team is also here, and I know that it's a lot of nervous around the production, so thank you for your job. And São Paulo, that let us use this magnificent place for this journey. So a lot of thank you to everyone that have collaborated, and if I'm missing someone, also thank you.
Having a hybrid event is absolutely thanks to all these participants.
Of course. So, well, I really hope that you enjoyed as much as I did. There were a lot of good insights, and we had great conversations happening today. We look forward to the next edition and you to participate in it. And stay tuned, because, you know, there's the next generation that Luis talked about. There's a lot of money coming. We want to celebrate spending some of it, and we can maybe do it together. So we have a plan, we have a strategy on building the most successful and biggest digital health hub from Barcelona to the world, and we may want to use some of this money to do it. I don't know if they will let us, but we want to do it. And if there's money that we can gather together, joining forces, we will also manage to do it together. So stay tuned, because we will share that with you shortly.
Let's see what's happening.
And that's all.
That's all.
And see you next year.
See you next year. Thank you very much for coming, and take care.
Thank you.
Bye.